I'm gonna close the door.
Good morning, Dr. Telfair.
Yeah, good morning. I was just sending a note to your colleague to let me have screen share.
Okay.
How are you this morning?
I'm doing well.
Good.
How about you?
Oh, well, long day yesterday, long day today. So
Yep.
you know the story.
Yeah, we have a community meeting at 6 p.m. tonight.
Oh boy. Okay.
So, so it's going to be an extra long day, but it's
Yeah.
all good. It's all good stuff. So I hope our meeting tonight we'll have good attendance.
Okay, that's good.
We're
Well,
getting,
you have a different office look yesterday and today. So
now, this is my home office.
okay.
Rachel and I both discussed that it was probably in all of our best interest for us to be in different locations because our office, we share an office and we have a DSU intern with us.
Uh-huh.
It's a bit much with three of us in the same space. And even when we have an area that we can separate, but it's still challenging with all of us. We like to be separate when we all need to unmute and speak and not have to negotiate between one place and another. So,
Yeah.
are you still working from home mostly?
Oh, I've never worked from home.
Okay, this is your office at
Yeah.
work. Yeah.
Yeah. No, we've been, I think I shared with you that we have been, essential employees, actually.
Yeah.
Uh,
Well,
I-
most days I'm in the office, but when we have big meetings like this, it's challenging
uh-huh.
because our office is so small.
Understood.
So have you, so your name is Rachel McConaughey right now. There are 3 Rachel McConaugheys. That's way too many.
Yeah.
I don't think the world can handle more than one of me.
I was just gonna say fame, fame is a fickle thing. So
Yeah.
you're famous in more than one place. That's always a challenge.
Yeah.
Good morning, everybody. I'm trying to figure out which one am I. Let's see. Let's start here. Oh, I'm that one. Okay. How you doing today?
Good.
We renamed ourselves.
Yeah.
So there's like 5 Rachels now, or 6 Rachels, I should say. Wow. Okay.
Yeah, I'm not entirely sure what happened. There's about to be another one. So if we could just have everyone put their name in the chat, the best thing I can think is maybe something happened during the registration process.
Yeah, that's probably going to be good because people are signing on and yeah, okay.
You can edit your name if you hover above your little picture. There's like 3 little dots. If you click it, it says rename.
Will the real Rachel McConaughey please stand up?
I'm so short, I don't think that'll show a difference.
So Nico, you can go in the right-hand corner and rename yourself. And then we have somebody from Mediation Center. Sure who that is. Okay.
That's me. I'm Lucy Rao.
Hey, Lucy,
Hey.
you know how to rename yourself?
Yeah, I'll do it right now.
Okay.
Well, it says rename, but it's not letting me do it.
Are we going to boldly go where no one's gone before this morning?
Yeah, we all should.
So-
Yeah, we all should be so lucky, right? But this
Right.
is like irony. I'm a big Star Trek, Star Wars fan, so you know, William Shatner going up in that rocket is all over my newsfeed.
They're everywhere. You have teleported. You teleportation, Rachel.
If only I could figure out how to do it for other things though.
I know. I know. So if you're just joining us, just please check your name because we've got multiple Rachel McConaughey's. We're not sure what the hiccup is. So not everybody can be Rachel this morning. So please rename yourself.
It's what I get for being an only child, I guess.
It's interesting that when Ruby came in, she was herself.
I think if you sign up and get the link from the sign up, or if you join as Rachel's link, it makes you Rachel because that's her sign up link.
Got it.
That's happened to me before. I was Nichelle one time because I followed her link.
I think that's what happened because I used that the email that she just sent not too long ago to log in.
I did too, instead of using my calendar.
So I guess that's the trick, is it has to be used via calendar.
Yeah.
So I guess we wouldn't be, well, or I'll just go through and rename everyone for the next sessions as well. Because it looks like I can rename people, but I don't think they can rename themselves.
No, I was able to rename myself.
Interesting.
Yeah. It's because for those of you who are just joining us, if you clicked on the link in the email, that's why you're Rachel McConaughey this morning. You can still change yourself though to be yourself, unless you want to be Rachel all day, and then you can be Rachel all day if you want to. But I wouldn't advise it. There's a lot of animals involved. Fish, dogs, ponies, lots of stuff to take care of. So okay, so we
From the email.
yeah. So just as you're joining, if you clicked on the link that was in the email that was sent to you this morning, make sure that you rename yourself. Because we've got a few folks joining that are all Rachel McConaughey. That's happened because you have clicked on the link that was in the email that was sent to you this morning. So if you would be so kind as to, yeah, hey, Angela, nice to see, glad you're
Good
with us.
Good morning. I ran up to pull my documents off the printer and I heard you talking. Thank you.
You're welcome. And I see Elsie's here. At least I think that's Elsie. Dr. Smalls down at the bottom. If it's not Dr. Smalls, it's a really great someone that could be her twin. There she is.
It's me. It's me.
A great glamour shot. Okay, so we're doing great. We've only got three Rachel McConaughey's. So if you're coming on, please make sure that you correct your name if you are able to. You hover on the top right hand corner of your name, of the name, and you should get a drop down box that allows you to rename yourself. Okay. So we've got 28 people and it is 10:01. We are on a record time here. And we will get started momentarily. I'm going to give everyone just a few more minutes to get on and get started. While we are getting started, if everyone would put their name and organization in the chat. Rachel, how we doing?
We've got 31 and we had 46 register.
Okay. Let's hang out for just a couple more minutes and then we will marshal on.
Because there's so many Rachels, if you're having, somebody put in the chat they were having trouble, but I don't know which person that it's displaying as Rachel. So could you please say something so that I can figure out which one across the top?
Hi, I think that was me.
Okay.
Who is me?
Kirsten Graham, Chatham County Safety Net Planning Council. Sorry, I'm driving, so it's hard to like multitask. I'm trying my best.
Glad you're with us. Be careful.
Rachel, I see someone else with your name, actually put their name in the chat, LaQuentin Cates.
Sorry, let me spell Kirsten correctly first. Well, we all know that I'm not good with names. Kirsten. Christian Graham. Okay. Okay, LaQuinton, can you please say something so that I can see you on the thing?
Yes, I'm here. Good morning.
Okay, are you joining by phone?
Yes, I had to dial in.
Okay,
Why not? See.
okay, there's one more Rachel McConaughey on the screen. Ah, that looks like it might be a City of Savannah person. Let's see. Okay, I sent them a direct message. Okay. Rachel, you ready?
I think that fixed the last of it. No, never mind. We still have an extra Rachel. But yes, I'm ready to begin when Dr. Telfair is, and I believe he's able to share his screen.
Great. I'm going to do a brief introduction. Dr. Joseph Telfair has devoted his 30+ year career and is internationally known for his research, teaching, and practice in the areas of social epidemiology, cultural and linguistic competency, public health genetics, and the elimination of health inequities and disparities, community-based and rural health practice, program evaluation, and policy issues concerning women, adolescents, and persons in under-resourced and underserved areas in our local, state, national, and global levels. Most of all, what I want to say about Dr. Telfair, he is a community advocate, and we are so grateful that he is offering us his expertise, his knowledge, his art and talent that he embodies in the area of public health. He's really has helped us really think very strongly about community development. You all are a part of that, and we appreciate you joining us this morning for the first in a series of these foundational skills for leadership. And this is what we're learning today. We'll build on the next session, and then we'll, of course, be talking a little bit more towards the end of our day about the upcoming sessions that'll be held in 2022. So with that, I'm going to turn that back over to Dr. Telfair. Thank you and welcome.
All right, thank you, appreciate it. Thank you all. Thank you, Ms. Roberts, for that gracious introduction. Can you see my screen? Good, okay, so this is the agenda for today. And I want to first welcome everyone here. If you should have this, and if you would pull that up, I won't have to go over everything, but this is roughly the how we're going to cover things today. We're going to go from now until about noon, and then a little bit further. We may get ahead or we may be behind depending on this, because here we would encourage you very strongly to ask questions. This is a lot of information you're going to get, so I'm going to warn you in advance. And that's why we gave you the handouts that we gave you. I'm grateful for the opportunity that Ms. Roberts and Ms. Chrysler from Healthy Savannah has given me to do this presentation. And the hope is that, you know, the focus is on leadership skills, and the hope is that you will gain some language, some knowledge, some skills, and that you put in practice what it is that we talk about today. So I will, without further ado then, you have the agenda in front of you. These are just by topic in the third column. And then the slides that are linked to those are covered. However, what I would like you to make sure you do is that you have questions, please either contact Ms. Rachel and let her know that via the chat or whatever, and you can unmute yourself and ask the questions. The one thing that I would besides the fact that you listen and try to comprehend what you can, one thing I please don't do, which is that if you really don't understand something and it's really not as clear as it can be, don't wait or do not hesitate, I should say, to reach out, and please don't just let it go. Ask the question, because what I have found, and many of us have found, is that the question you have is most likely the question that a whole bunch of other folks have. So we want you to be able to ask the questions and ask them clearly. So what I'm going to do to start off is that I want to kind of go over, before I get to the actual slides themselves, we've sent you a bunch of documents. So I'm going to take a moment now to go over those documents. I hope this works. Just to let you know what they are and that you can essentially do that. So one of the first documents you'll see is one on writing performance standards. This is actually something that came out of the larger office, and that's been used across the board from the CDC, YMCA, and that sort of thing. But what it really is something that we will probably cover much later on. But it's a very straightforward, very simple document that gives you an idea on how to do this. And it's been around for a little bit. It's been adapted across multiple CBOs and agencies, particularly around the YMCA, YWCA, and like agencies. That's where we first started this and developed this when we were in North Carolina, and we worked with the state agencies as well as in Greensboro. We worked at the Greensboro Ys, both YM and YW. And that's the work it has. So I thought that would be really useful to you in that sense. And then I have a series of other documents. The first one is something that we developed when we worked with the state of Alabama. And what it is it teaches you how from step by step, both from concept to idea and for practice on how to write goals and objectives for program planning, monitoring, and assessment. We'll look at that a little bit today, but we really are going to get in it in detail when we start the effort in next spring. So if you could sign on for that, that'll be great. The next document, is actually the worksheet that goes with that. So if you look at that, it takes the 8 steps itself, but it also gives you a template to work with so that you can do this. So if you went to the 8 steps document itself, it's written as a handbook, and it provides a lot of work there, gives you an introduction, overview. It's like a manual, that sort of thing. However, there's one thing they kind of walk you through how things work. There's another things to get the hands-on experience. So what we have in the workbook is for you to apply what you are trying to do. For example, if you're writing a grant, or if you're writing a technical document or something like that, and you want to practice on how to put your goals and objectives together, this really walks you through that bit. So you have those 2 documents there. We are going to, if we get to it, we'll practice a little bit with this workshop, but we may not get to it. So, but it will definitely be part of what we do for the evaluation bit. So I'm going to get rid of those. And then the next document I gave you is something that we developed for our, as a handout actually, around community organization development. And this is something that you know probably both intellectually and some in practice, but this kind of gives you the idea of how to really put this together. We worked on this and updated this on several occasions. We've done a lot of training on community development and community work. And so we've worked on this, and this is particularly geared towards work that we did with maternal and child health populations. And we've used those as an example. We developed this a while back when in our early days, but we've used it over and over and over again. And I would say we've used it not just here in the United States, but we've actually used it in multiple countries. and been able to get it. It's actually been translated multiple times by other countries, and we're really fortunate to have that done. So that is the document that you have there, and we hope you can look at that. It's a handout, and we do our community development training class in work, and we use that document there. So the other document that you have is actually one for that we're going to talk about a bit. So you all are very accustomed to using logic models. And one of the things that's challenging for a logic model is it's pretty static. And so it's not a dynamic model. And so one of the things is that what we want you to be able to get in the habit of, particularly because we're talking about systems change, is that systems do change. They are not static. And because of that, it's critical that you learn how to not only develop them, but also how to assess them. So this gives you an example of how to use like the 8 steps that we showed you earlier, the community development we showed you, and now here's a way to measure this. And we'll go over that. And here's something we developed based on our research and our evaluation training. It's actually in one of the books we wrote, and we pulled this out, and we'll go over this with you. But you have this in front of you. I'll refer to this in our discussion, so that this document you'll have there. Let's see, the other document that we have, yeah.
Dr. Telfair,
Yes.
Dr. Telfair, this is Paula. The only thing that's shown up on my screen still is the agenda, and I don't know if that's the same for everybody else.
Okay. So the documents I've been showing you are not showing, the other ones are not showing up. The agenda is still the only?
Yes.
Oh, boy. Okay, well, all that talking and
Sorry, I thought about saying something earlier, but I wasn't sure if you were like, you're talking about them because everybody has them, but now it became more clear that you were trying to show them on the screen too.
yeah, okay. So what I'm gonna have to do then is I'm just gonna have to talk about them, and I'll pull them up as we need them. Okay. Yeah, that's the challenge about screen sharing with this one. All right. All right. Well, what I'm just saying is I'll just talk about it then, because you have something called the Project Achievement Matrix. Again, this is a tool that you particularly y'all who work in measurement and you work in program, particularly if you have multiple programs, or in services under a program to use. And we'll talk about this thing, but it's called the Project Achievement Matrix, and I'll refer to it as we go along, and you'll see some examples of it as well. Sorry about the sharing bit. So let me then share the training slides. Do you see the slides? Okay, all right.
Yes.
So I'll just go ahead and start from there. Okay, so this is the first slide. So again, I just want to thank everyone for co-sponsoring this. And I want to start off with and see if you had any questions. I talked a little bit about the tools and everything that we have, and hopefully you got a chance. If you didn't, or you're looking at them now, are there any questions that you want to try to get answered before we get started? Okay, so, all right then, well, I don't hear anything. So I'm just gonna go ahead and proceed. And again, if there is something that you need to ask or you don't see, please let me know and I'll stop and try to answer the question. So the way this is gonna work, particularly this first part, which is today, is that we are going to do 2 things with this training. The first is just to give you an orientation and overview around the whole idea, if I will, the whole idea of program development and planning. There's a lot to it, and some of it you've done, whether you've had formal training or not. Others you've had formal training and you worked on this. So some of this may be a review because you've had the training, or some of it may be a review because you've done it. It just hasn't put the words to it. So we're going to work on that part first, and then we're going to focus on the how-to bit. And that is not, it's not going to be sequential where we start on, here's the introduction of things and here's the how-to bit. We are going to integrate the two because that's the way we learn. We sort of talk about it, then we do this, take the steps. We talk about it, take the steps. So that's the approach I'm going to take. And I hope that that is one where that will be really useful to you. So the first thing I'm going to talk about is just kind of give you an idea of why do we do this in the first place? Why is this idea of program planning so critical? Well, one of the things that is so critical is that, you know, being able to just lay out how something is going to work is going to be really helpful to looking at how successful you plan to be. It also allows you then to also pay attention to what's working and what's not working, and then the why, the how, and the wherefore on that. The other part of it is that many times we who do community work are always in the mode of having to explain to those who are decision makers in so many settings, you know, how we're going to do something, and also be able to have the evidence or the facts in place to say this is why it works. We also need to understand what is it that we need to get things done. It's one thing to say here's the idea of how it should work, but also, you know, being able to come up with the elements and the work to be done. So the idea though is that you have something that you think is a good idea, you know, like a program to serve persons with diabetes. However, the other part of it is that that's the idea, but how are you going to make it work? And what are the elements you need? And you don't want to overpromise this, but at the same time, you want to underpromise as well. So to say the common elements are there, but also being able to communicate the work and communicate what it is that needs to be done. So we're going to talk about all of that, and we're going to talk about that in terms of the oversight. So you as people in position of leadership are going to need to be able to talk to both yourself, those who are decision makers, and importantly, those who are on the front lines doing the work itself. So the thing you're going to talk about then is like, what is the program about? So if you say we want to do a program to serve persons who are experiencing persons with chronic illnesses, disabilities, but who are also experiencing discrimination of one type or another. Well, that's multiple elements there. The chronic disease and there and chronic disease part, but also the discrimination part and what types of discrimination you have. There's a whole concept of intersectionality that talks about that, and where persons based on the diversity of who they are and what they do also can experience ways in which they become disenfranchised in work. So you need to talk about that. You also need to say who it is that you're trying to serve. Who are the client and what they are? Who's the target population? Where are you trying to work? Are you trying to look at, so to say Chatham, Savannah specifically, or are you trying to look at the 9 counties, particularly the 8 counties that are mostly rural that you're also going to serve? What is your geographic areas? Who do you need to do the work? And then to what extent is the work going to be done? Are you going to have a single service, which is like, say, provide food or shelter or medical care, or are you going to have a wraparound comprehensive approach? The question of that you have to decide on pretty early on, and then decide on how you're going to make it work. And then the time frame for that. Is it going to be 1 year at a time? Is it going to be a 3 to 5 year project, and so forth? So the basics of this is, in developing the program, you really have to think and plan it out, like what it is that we really need to do. So you start off here, you can look at this one, is that you start with goals and objectives. So what is it, this part? So this last part that we mentioned, which is here, goes into your discussion related to goals and objectives. And then you talk about what it is that you're trying to do. Are you just trying to learn about what the challenges are, and that in terms of just development, or you really then have an idea in mind where you want to apply an intervention? And the thing about an intervention, just to keep this in mind, is that developing a program is one thing, just provide services. But if you divide an intervention, that means that you're trying to make some kind of plan related to change. You're trying to change something, change the way services are delivered, change the way the outcomes of people receiving the services, are being dealt with, improve the lives of other persons. So all of those are change-based types of approaches. Then you do the program, put the program together. What's the program going to look like? And as a reminder, programs are the broader areas in which work will be done. Services under those programs or where the work is being carried out. So the program itself is going to be the overarching effort that's designed, say, a program for persons with chronic illness and disability, say diabetes, and then services. These services could be medical services, they could be support services, they could be psychological and social services and so forth. But they all come under the programming part. Critical to all of this, of course, is assessment. So you have to really know, you have the program, you have the services, but you need to know whether or not they're working, first of all, whether they're working the way you planned them to do, which is monitoring. And then second of all, whether or not the intervention that you said is you put in place with the hope of making change, whether that change is working based on where you started, which may be, receiving persons not having any help to persons receiving help, or persons having different degrees of challenges to levels of reduction of challenges. So that's the changes. And then you make a decision based on the problem analyses and assessment that you have, which is part of this work itself that leads into goals and objective. But the program analysis and needs assessment, you do that both at the beginning and at the end. And then that allows you then to see where you need to go pretty much with your next steps. So that's like an overview of kind of thinking about where a program is and what the program's part and planning process itself. Are there any questions related to that? This should be pretty straightforward. All right, so let's go to the next bit then. Now, here is models. So one of the ways that we have a philosophy that if you could draw it, you can understand it. So you're going to see in this series of presentations a lot of drawings, a lot of diagrams, a lot of charts, that sort of thing. The idea behind it, though, is to give you some idea of how things work and also give you a template to use so that you can structure how you visualize how things work. And one of the things that what this allows you to do is not to lose your place. And what do I mean by that? So many times in the delivery of the carrying out of larger programs and delivery of services in those programs, you can go for a good long time in just doing the work and not really taking the time to ask yourself, is it being carried out the way that we wanted it to when we first conceived this or thought about this? Are the people being served in the way that we think they should be served? Is the information that we're using actually that we're collecting being used in such a way that informs our next steps and how we're to go? All of those are critical because what you need to be able to do is to be able to have those answers, because when things come up, when the program changes, when the environment even around the support of those program changes, which does happen to us who work in communities, communities do not exist in a vacuum, and programs and communities do not exist in a vacuum. They are influenced by the physical settings, the social settings, the political settings, even the people who come and we targeted for work for. And because of those things, we need to keep that into account. So this is a generalized model, and there's many models that I'm going to go over with you. And I would suggest, think about what works best for you. So when we who do this work from where we sit, which is helping people to design programs and to carry programs out, to assess programs and so forth, this is kind of our way of approaching this. However, what we know is critical is you in your own efforts adapting these, because you all who are in leadership positions have to make critical decisions about levels of adaptation of the work to be done, because you have accountability. You have fiscal accountability, you have personnel accountability, you have constituent accountability, you have political accountability. You have many things that you have to atone for. And so having a way to present this information and assess this information and make decisions for is constantly something that you're dealing with all the time. So again, if you look at the table from left to right, what you'll see is that this is your decision making. This is when you sit down with whomever you need to sit down with and say, we need to get a program to cover, such an effort. So, for example, dealing with the poverty that's in our area. We know we have a high rate of poverty that's in our region. And we know that that high rate of poverty carries over into a lot of different areas. So if we target, reduction in poverty, then we know that we're going to be able to target reduction in a number of other areas of need, like health, like housing and so forth. So that's why we need to do a really thorough needs assessment to start off with. We need to then decide on our goals and objectives, develop interventions, implement our interventions, and then evaluate our results. And then go back to the beginning to see 2-3 years later, are we still have the same needs? So at each stage though, what this does is that it just gives you the basics. And what this just simply tells you is that if you had to explain very simply to someone, how do we go about doing this? And I need to fill in the blank. So if I went into this chart and I sort of took all the text out and just had the walkthrough, you would fill this in on what you see. So you would say what kind of data you need. You would say, what do we need to do? How are we going to achieve or realize our goals and objectives? What is the intervention or interventions, more than one, that we need to enact? And then how do we know that stuff is working? And we can do it a traditional evaluation part. We can do it in individual quality improvement, quality assessment, quality effectiveness, whatever way you want to look at that, we can do that work. But really, how does this work? So let me walk you through this. So first of all, think about the general model itself, these 5 basic elements, 5. First one, of course, is the needs, and thinking about what is it you need to collect and how do you analyze that information. So it's not just saying, here's the data, but also how we make sense of the data and how are we going to use that. And then that should use to inform the goals, which is a broad goal, which in and of itself is just your aspirational thing you want to do. And your objectives, which is basically how you're going to carry the work out, how you're going to measure it, your time frame, and so forth. We do have something on SMART objectives, which all are familiar with, and that would work there. So this is really identifying what will be accomplished. And then you decide on what the work's going to be, then how you're going to carry it out. That's going to help you realize your goals and objectives, and then you're going to implement your intervention. And of course, like I said, step 5 is going to be your formative evaluation, which is the long-term work you're going to do to assess and pay attention to the quality of the program. And it's going to be covered in part 2 of the workshop, which is in the spring. And then the summative evaluation, which is the effectiveness of the program. Now, the thing that I want you to keep in mind is that pre-planning is a quasi-step in the model. So in other words, it gets you to think about where you want to go. It gets you to think about seriously, how are we going to make this work? But it's not included formally, since what it is that you're making decisions beforehand in terms of how you would proceed. So for example, if you say we're going to have a poverty program that is going to, for our area, you may decide that you're going to roll that out in stages as opposed to roll it out in one big program. So the stages may be targeting certain groups. So example, families may be your first group. And then your next group may be, adult males. Your next group may be, communities and so forth. So you have it, and you may decide beforehand what the program is going to be. So if it's a program for families, that's one program. If it's a program for adult males, that's another program. If it's a program for adult women, that's another program. If it's a program for a region, like a particular area of the city or the county, that's another program. So your pre-planning helps you to make the decision as a leader of what it is you're going to emphasize going forward. So that means that instead of a program to address poverty, you have multiple programs to address poverty. And they all have the same idea, that they're going to reduce poverty in their area, however way you define it, but they're not going to all be realized at the same time. And there's a lot of reasons for that. Finances is one, personnel, there's another, political will is another, so on and so forth. So you may have that. So just keep that in mind, that pre-planning helps you decide what the programs are going to look like for the most part. And then the rest of it, we're going to carry it out that way. All right, so that's the first one. So now the generalized model will also help you in terms of making decisions about the services and things you're going to adapt. So what this generalized model approach helps you to do is to really make some really pretty targeted decision. It helps you to streamline the development process itself. It helps you to also think about what it is that's going to guide what it is you're trying to do. So the program development and assessment process you're going to do. It is linear to some degree, but it's also, goes back in circle and it aligns with the protocols that you're trying to put together and put in place. Now, one of the things to think about is what is your program model going to look like? So what is it that you're going to do? So if you decide, for example, in your pre-planning, we're going to focus on our priority area, which is families. And we're going to focus on pulling things together that allows us to do a reduction of poverty as we have defined it with families. So that means that your constituents are going to be families, and you're going to do this in a partnership process, like most of us do. And who are the stakeholders and who are decision makers? In other words, who are going to be in leadership roles and who are going to be that decision makers, who are going to be program partners, and then who are going to be your consumers or your constituents. And so in this case, it would be your consumers, of course, would be families. And you have to define just to have an inclusion exclusion criteria for who the families are going to be. Are they going to be families of children of a certain age? Are they going to be all families living in a certain area and so forth? Your program partners, who are they going to be, depending on how you define poverty and how you're going to target poverty. Are you going to target it related to reduction and food apartheid issues? Or are you going to look at it in terms of access to healthcare, access to social services, access to mental health services, and so forth? And then the decision makers, who's going to be in the lead and the role? Is it going to be a single agency that's funded, say Health of Savannah, or is it going to be agencies, that are going to work closely together, like we come together for this one, and who are going to be decision makers, who are going to be in leadership? And so these are the kind of the first steps. And then how are you going to make sure the program is going to be supported? And then what's your time frame? Are you going to do a 1-year effort, which is the traditional kind of governmental model, or are you going to do a 3-year effort, which would actually realistically allow you to assess whether something is working or not, depending on that. You have to then decide on what it is going to be, resources you're going to do for data and analyses, or lack thereof. So you may want to know how the programs work, but you have to make a decision on this one. We all know over and over again, a lot of programs start up and they're focused mostly on delivery of services. However, they're not what they lack is some kind of data collection and analyses to let them know if things are working or not. We all know this. There's a number of programs, and this is probably the most common scenario for us who are in the business of helping programs to assess, their strengths, their efforts, to assess the work that they do, to assess their outcomes and so forth. It's a bit frustrating. However, we know this is the case, and so it's not uncommon to come into a program that's been up and running for a couple of years and then starting the data assessment process, because that was not something that people put it in place. And we also know that a lot of times people starting the program may not even be the same people running the program at this point. And so those are all issues. So the program model needs to have some kind of plan, and the plan itself needs to include these elements. And it should be the involvement of the partners to a great degree. Because we all know that the work that we do cannot be carried out by just a single entity alone, not for any sustained period of time, and not if we really wanted to make a difference. So the client, the population, the community are all those that need to be involved. And then the preference of an agency or an institution, which goes back to the decision-making roles, also need to be considered and carried out. Now, why is that? Well, that's because we have the capacity to not only lead in this process, which is the development and planning process. But we also need to negotiate how we think things are going to work in the long run, particularly because we do not live in a monolith, that we don't live in a heterogeneous society. And our clients are not heterogeneous. They represent a very broad and very diverse group of persons. Are the people who are invested, or which are stakeholders, are very diverse. The decision makers are very diverse. So we suggest that you keep in mind these 3 F's: fluidity, which are how you think things are going to work and what's the appropriate model to use; flexibility. And so that is where I could say often enough, there were real challenges, because there is this push and pull between when you submit for funding and support. Generally, the persons who are providing that funding and support want something that's pretty concrete and doesn't really change all that much. But at the same time, as a community and a leader, that the minute you submit something for support, within a very short time, things will change. And that is a very common thing. So you cannot, forget that. So how do you sort of resolve that? Well, we suggest very strongly that you, in your assessment, you make it clear to those supporting you that you need to have flexibility and you need to have adaptation. So whatever program model you suggest or you try to use, you build that in. So when you're proposing to those who are going to support you, you let them know up front that these are things are going to change. And then, of course, the whole idea of making sure that you have what you need in place and the parts fit together. So functionality is very critical. For example, to improve things like health conditions or social service conditions or mental health conditions. And it's something where that's going to be your outcome. That's what you're going to see the change. It's not just simply asking yourself, is the program working, the way we want it to? That's one level of questions. But what you really want to know is that, are we accomplishing and are we having the outcomes that we think we need to have? So I would just say consider, at least from our perspective in public health, is more of a population-based approach, even though I know most services gear and they do that, but it's the person. We want you to think about it as the person within the group or the person within the population. Because you are a decision maker, and the individuals are going to be the ones that are going to benefit. However, those individuals are within a population. So all the decisions we've talked about up to this point will need to go into considering what that's going to look like. So that means that the bigger picture, which is your ecological framework, which is your individual, within that, they're your priority, but they also live on that. No person sort of are one-dimensional. They just are not, say, someone with a mental health challenge. Well, that's what they present to you with, but they have a life and they live in it with a group of persons. They live in a community and works like that. So please, you have to consider when you do the program model, what's that going to look like? So here's some of the models that we will discuss and some of them that we will hold off to another time. But these are models that I think you need as leaders to consider. The classic precede proceed model, which is what we're going to talk about a little bit, which is what we use a lot in health education and program planning. The mobilization for action and planning and partnership, which some of you already use, because particularly if you're involved in some of the groups related to social service delivery and mental health delivery. The MAP-IT, which is a mobilization and planning, but also adding in the tracking part, the IT part. So that allows you to do that work. And of course, the model that's focusing on SMART objectives, which is really built into your performance goals. So when you're looking at what you're going to achieve, for example, if you have a training program where you're training persons to work in elder care programs, and the goal of that is that you're going to train them and you're going to monitor their progress. There's multiple layers to that. Besides the persons you're training, there's also the actual elder care facilities that themselves need to give you feedback. And then they need to train on that. And then the persons who are in the healthcare facilities also need to work. And we'll talk about SMART objectives. And then we'll talk about the Plan, Do, Study, Act approach, which is the short term. So a lot of times the idea is that you cannot always do long-term planning. You sometimes need to do things in increments, whether it be 3-month increments, 6-month increments, 1-year increments. However, you also need to build on that. So the Plan, Do, Study, Act, or the PDSA model, it's a business model, but it's a business model that we apply a lot in our neck of the woods in terms of health and social services and mental health services that allows you then to learn from that. So it's a stage thing. So each thing for that, but also it's also part of implementation, planning, performance work, and so forth. Now, some of the other models, which are we're going to look at, which is specific planning in health program planning. There's a SWOT, analyses, which you all should be very familiar with, and what works and what doesn't work. And then we're going to talk about intervention mapping, which is we're going to end with. This is an approach that is going to lead to some of the work we're going to talk about in the next set of programs. But the intervention mapping allows you then to show the links between setting up goals and objectives, designing and assessing those, designing evidence-based or informed interventions, so forth. And of course, there's others like healthy communities, health communications, and healthy planning. So those are the broad modelings that we to look at. And those are models to consider. And again, let me repeat, the reason why you consider models, because they provide a structure, a written structure or illustrative structure that you can clearly communicate to everybody involved. You can communicate these to decision makers that are above you, to yourself, to the other stakeholders that you're working with and planning with, even the clients and or the consumers. You could walk them through how this program works and what's there. So you may have noticed, without thinking about it or even realize that you do this, but when you put together brochures about your program, you are actually showing people the planning model that you have and that you use as you're walking them through what works and what doesn't work. Okay, so those are planning models in that part. Any comments or questions to this part?
Dr. Telfair,
Yeah.
I just am curious, we've had some conversation about thinking about in terms of policy systems change. And I just am curious about your take on the models and which one might be, is there one that might be better suited for a policy or systems change approach?
Well, the policy ones, you need to have, the model itself is your decision, but policy changes need to be ones where you have a high degree of adaptability. So I would just say, going back to what we talked about before, which are the considerations. So I would focus in terms of the model itself and look at policy. So each policy itself, depending on what the policy is for, it could be a policy that's very narrow or policy that's very broad. It could be a policy that's just very A-specific. So it's just sort of like says, here's what we want to do, but without giving the details, or it could be one that's very detailed. So it really depends on the policy that you're looking at, first of all. Second of all, you need to make a decision about how it is you're going to approach that. So I would just say, look at the 3 Fs, which is, what you think will come, flexibility, and then the functionality bit, but also who are you working for? So within the models themselves, they all have those elements related to them. But however, my strong suggestion would be to pick ones that are thorough, like program development, like Pre-Seed Proceed is a definite go-to. But to map it, which is a combination of the partnership work and the planning work with the assessment, is because it includes it encompasses a lot of the other models, would be, to me, a stronger one of that. And for planning, though, for addressing things that you're planning, if you're really looking at change and you're looking at change coming at a rapid pace, and for example, if you have, like you're trying to map out or you think about change, but you want to make sure that the change itself is things that you've learned from and will use, then some kind of performance measurement approach like the PDSA would be good. So the bottom line is, it's critical that in a pre-planning stage, you know, before you get to that, if you go back to what I said earlier about the 5 steps, the pre-planning stage is when you decide what your approach is going to be. And then based on your approach, that will help you then narrow down what model works best for you, particularly around policy issues, right? So for example, if you have a policy issue that has to do with what we've all been dealing with, which is the COVID, right? And you have mandates versus non-mandates and so forth, but you have to work around those things because you have to create a healthy workplace for your constituents, a healthy workplace for your workers and so forth. So how do you work with that? Well, that requires a lot of back and forth between people in decision-making roles, risk that you're going to take in terms of having to be accountable and deal with these mandates and so forth. So that means that you got to have one where it's going to be changing. So PDSA would work a lot in that work, but also one that has a lot of flexibility built in and a measurement built in with that. Does that make sense? Okay. So we'll talk about that actually in our next grouping, which is on understanding system change as a leader. Okay, any other questions or comments? Okay, all right then. So what I'm going to do is just jump right into it. So systems change. Why, first of all, why are we talking about this? You know, systems change in what we're having. So we're talking about program development and planning. So our DAP, you know, so what does system change have to do with program development, you know, and planning? Well, I would just say that it's a core issue within that. And the reason is the same thing like what Ms. Roberts just brought up. You know, you may plan out something over a 5-year course, but you all know, remember the saying that the one thing that we can count on about community is that they change. Well, the one thing we count about programs and services that we provide is that they change and that they have to be adaptable. And that means that that's one thing. But the bigger question is programs, services, you know, the people who work in them and so forth do not exist in a vacuum, you know, and they have bigger organizations that are called systems that oversee what it is. These are the environments. These are the things that we have to work in. We have to work in governments. We have to work in institutions. You know, we have to work in community settings. Those are called systems. And because of that, they are the things that may change. And that change means we have adaptation. Like I said, the most recent, biggest example we have is that we in our system knows that, you know, when you have an outbreak of a thing like a COVID or even a Delta, one of the things you really should be doing is trying to get everybody in the best place you can related to protection and other things. However, if you have pushback that are policies that are designed to not allow you to carry out what you know and you've been trained and to work that actually is working supportive, you have to figure out how you're going to make that work, how you're going to work in that particular thing. And that's a change that happens. So the definition, the big definition is that you have it in a organization or program or policies and where you exist. In other words, your agency, whether it's a government agency, whether it's a CBO or whatever, you know, that encourages and supports and directs you to how things are supposed to work. And it works at multiple levels, at the higher macro level, the meso level, which is the interaction between that micro level, meso level. So that means that it works at a bigger, broader system level, community level, individual, on those things. And these are all affect health outcomes, they affect social service outcomes and so forth. For example, on the slide here, what I give you is an example, like a regional-based social and public health collaboratives that use a biosocial model of care to guide decision-making. In other words, then, if we plug COVID in there, That means regionally, you're making decisions, not just based on your individual agency or institution, but it's collaborative. We all know that you have to work together because you have to achieve a certain high degree, for example, of vaccination in order for everybody to be able to do their work. And so that's a regional decision that's made, but that's a system decision. So the what of it is addressing root causes of health and social challenges that we face. And we know that historically, in many cases, those that we serve are those that have historically been at disadvantage for one reason or another and have not had the privileges there. Or there will be those that are privileged and have had those privileges, but the root cause of that. So the root cause, why is it? What caused this in the first place? Now, these things are often stubborn and embedded in the networks of both cause and effect or relational. And what we mean by stubborn is we mean these things are hard to change. They're hard to make a difference in, right? If you are going to deal with discrimination based on race, gender, sexual orientation, chronic disease, geographic region, those are things that have been around for a long time. And we know, based on the work that we do, that we should see and make change for those, but they're stubborn, and they're embedded in these networks because it's while we may hold individuals accountable for some of these things, we know that those individuals work within networks and systems, and that empower them and allow them to carry out this work. And so anyways, they just don't exist in a vacuum. I'll keep using that phrase over and over again. They're networks, and these vacuums are what you need to change. So changing a system, you could be the best worker, in a particular institution. But if the institution has a philosophy, point of view, an approach that is not congruent with the way you work, your level of effectiveness is going to be really limited. So it's an intentional process of change. So you have to change, not just you, but those around you and where you work. So that's why we say it's an intentional process. That's the fundamentally altered the way that components and structures work, and that cause those things to work in a certain way. So it's not enough to just change you or your neighbor or the person next to you. You have to change the way that the whole institution works. So understanding system change means that we have to directly and innovatively deal with the root cause of the realities in which we carry out our work. So we will only be justified in consequences of broken programs if we don't decide that we're going to work on these things. So keep in mind, program development and program design is going to be dependent in terms of their ability to carry out what they need to do. They're going to be dependent in their ability to carry out what they're going to do by the system in which they work. So by the decisions that are made, by the values, by the intent, by the targeted outcomes, and so forth. So we would not be able to create change we want to see if we do not focus on the root causes or the things that allow the system in which you work to function the way it is. So in other words, then, very simplistically, and we'll go over this, say this multiple ways, if you're going to make the change that you want to see, you have to change the system in which that works. So if it's a hospital system, if it's a CBO system, if it's a academic institution and so forth, the work itself needs to be focused on those changes as well as the other changes you need. So it's not just enough to say, I'm going to go and do the work. I'm going to, put my hands on the people. You have to also decide those that are above you, those that are making decisions, and the overall institution your work needs to be. So implementing system change means you address the health and social challenges that you face. It also means, and it provide a helpful way to understand them and to assess them and to set out principles that you think will guide you or that will guide you in achieving the change you want to see. So let me kind of break it down for you and talk about 6 principles of systems change that I think you really need to keep in mind. So the planning for systems change, are the first 3 principles, which is understanding needs and assets. In other words, what's there, what needs to be done, and then what do you have available to you get it to work. So it's not enough to say we have a problem with poverty in our region, or we have a problem with delivering of services, or people accessing services we have. That really identified the needs. But do you have the means, to adequately address what it is that you're trying to do? And if you don't, then that's where you need to look at and see why. And that's generally the systems change that you need to plan for that. You need to plan on how you're going to grow the assets to address the need that you have. The other part of it is engaging with multiple persons, so constituents and your partners in the work. And in public health, I can tell you, we all recognize that getting work done is not done by a single agency or group, really. And that's also true for community-based community work. And that if we're going to be advocates, we're going to really influence what we should do. We need to advocate for multi-systems and multi-systems work, multi-community work, multi-agency work to get things done. And then we need to map out principle number 3, map out what is there. So we do the work. For example, you have the CGIC that's run. It's made up of a large number of like-minded agencies, programs, persons. The idea, though, if the CGIC decided they would want, as a group, like what we dealt with a while back, which is the mapping that it does to reach out and say our service is being delivered. You have a whole list of goals and objectives. I'm sorry, Ms. Roberts, I can't remember the name of the document that you have us review on a regular basis. But that lays out, that maps out, what you said in principle you're going to do. And then you have to decide who are the best agencies, programs, individuals as part of that work who can carry that work out. So part of system change is recognizing the entities that are in that system that will allow for the change to occur. Now, the other part of change is making it happen, which is doing the system change, which is doing it together, which is putting your egos at the door and deciding that you're going to distribute the leadership. Because part of that, as you know, leader as servant is one of the most powerful approaches you could take. Where you are in a position of leadership, but your target is listening to those that you have responsibility for, and then working with them to make sure that that what they see and what you agree that they see are the best things need to be carried out for whatever you're responsible for. And that means that your goal as leader is to guide that work and to do that, but also distribute the leadership, diversify who is responsible for what, right? Being able to carry the work out itself in such a way that there's a high degree of delegation in the work itself. And then the last part, of course, is what we all need to do, which is a foster of learning. It makes no sense at all to put a lot of work and time into changing a system if we do not learn from that. And so when in that part of that needs to be work. Now, learning itself is not just not building the evidence per se, but it's also figuring out how to make things work. How do we win and how do we practice patience, listening, respect, all the things that we know drives, our ability to carry out good work. And also that influences us, it makes us leaders in what we do. And also, how do we learn from the mistakes that we made? Many of us, who are in leadership roles, we know that we didn't just sort of get into the role and automatically we were perfect from day one. That's ridiculous. Now, if you are that way, please, I do want to talk to you. If you're perfect as a leader, I definitely want to talk to you and learn how you do that. None of us who are in leadership roles, we know that we're human beings. We make mistakes. But what do you do with those mistakes? And what do you do, what you learn? And then also the listening, when others tell us, that didn't work or that could be done better, that sort of thing. We need to be humble enough and practice that type of cultural humility that says we do not know everything, even though we're in leadership roles, but we can learn from those that we have. So fostering learning encompasses all those things. So there's a couple of questions on leadership that I think you should consider, and I've written those on the screen. So in your program or your organization, is it open is it open as it claims to be? The other thing is that is it as bold as it asks others to be? does your program bear as much risk, you know, as it asks grantees or others to hold? Is your program as humble as it should be? In other words, as I spoke about leadership, you know, is your program okay with sharing power? You know, do you have a round table or a square table, you know, in terms of decision making and how you work together? And then of course, do you share what you learn and the work that you do? So this is all in the learning that we have around systems change. And it's six key principles. And in these core questions are part of that. So as we do our program development and planning, we need to think about this. So here's the other 3 reasons why I think you consider what's called, you know, what Misra and Maxwell call, you know, a systems mindset. Because what you're looking at is that you're not looking at something where it's going to be proximal, you know, or even intermittent. You're going to look at something that's to be long-term. The goal and the idea behind systems change and the idea behind putting a program in place is that you do not want to put something in place that has a short lifespan, particularly if it's something that you and those that you work with are very passionate about. So if you are really committed to providing mental health services to persons who have a hard time accessing mental health services or to groups that are hard to reach, you know that is not something that's just going to have a short term, a 1-year project or 2-year project. That's a long term. So growing a system is a lifelong practice. That means something that you're going to need to commit to and work on for a long time. And yeah, you know, we get exhausted. If you do that kind of hard work, you get exhausted. But have a plan in terms of, you know, when to step away and when to step back in, or step away, succession planning, you know, or training others to pick up the slack, delegating work, those sort of things. Those are all long-term things. Those all allow you to sustain long-term in the work that you do. The other part is a mindset is open up a toolbox for solving issues. So what do you have? There's, there is not, a hammer is not the tool for every challenge that you have. You know, you may need to be flexible. Think of other ways to do this. Problem solving, critical thinking. What are the kinds of stuff you need to do to resolve this? The things that come at y'all are varied, and they come at you varied at different times. You may not know that that's an issue. You know, one of the challenges that we have, for example, during this time, you know, particularly during this last 2 years, is the fact that we have very strong and very knowledgeable, very capable persons who in their everyday, day-to-day work are just outstanding what they do. However, one of the things that we forget is that they're also human beings and they have challenges. So one of the things that we have to pay attention to is their mental health and well-being. And we are appreciative, you know, of some of the work that's been done, you know, on that matter. We just yesterday had a conversation about mental health and well-being, and appreciative of the work that Ms. Vera Southbourne and her team sends out to people all the time. And I can tell you that people use that, but that's a tool that you don't always consider, but it's a tool for solving a challenge, because what it does is it allows people to be revigorated and then continue the hard work that they're doing. And also how you come about that. Just because you have this really good platinum level program doesn't mean that it taps everything. You know, if it's a food-based program, well, it's a food-based program, that food gives out that. But you also know that the constituents have other challenges they have to face with and so forth. So it's a systems level thing. So the last part of though is that you learn how to enhance your system itself by sharing broadly across networks and across across networks and work with other people, but at the same time listening to those that you could learn from, you know, because there's always going to be those who are engaged in other types of programs and services that we did not think would be really helpful to know, right? Think about it for a moment. You know, if you are a program where your effort is the food sharing program or health services program. However, there are grassroots programs that focus a lot on issues related to helping people deal with issues of discrimination and other things. And then you begin to see that those issues are also part of your constituents, that not only do you have these concrete needs, which is for housing and food and health, but they also have emotional and other types of needs, that your program is not necessarily, that's not your role. However, the grassroots program, and others there may be available to help you to get the work done. So consider a mindset that focuses on, as a lifelong planning, that building the tools in your toolbox, and to be effective to working broadly and in work with other types of groups and efforts. So these are the questions that I think that occur if you're going to change systems. And it's critical to think about changing the system in such a way that it's going to allow for these great outcomes to occur. And that's what you want. You want great outcomes. You want things to change. You want things to improve. So, who is the different players to include in your systems? And why, what is their relationship and what's the power dynamic? Do you share that with them? Are there reasons that some things should stay the way they are and some things may change? So status quo. What is your readiness or capacity for change? That's one of the big questions. We talk a lot about it, but when push comes to shove, are we really ready to make a difference? Are we really ready to, if the system says we need to change the way we hire people, screen people, we need to change the way we reach out to others, we need to change those or even in our funding stream because of all kinds of other social and other dynamics and so forth. Are we willing to do that? Are we willing to change even the way that we have our leadership structure? Those types of things, or all the stuff you need to be thinking about. And then what is the best strategy for influencing that? What is the best strategy to approach that? Do you need to do a really in-depth planning process, strategic planning process? Do you need to change your goals and objectives? Do you need to take a step back and look at your vision statement, your value statement, the way you're going to carry things out? What are those things that actually influence that? Because that's going to tell you how you're going to move forward, which is what you want to go. And then what process should you use to implement these changes? Once you've made those decisions, how are you going to do that? And then, of course, we need to learn from what's working and what's not. So you need to have in place a really good way to assess whether things is working or not. And the Packard Foundation actually has a lot of these things that it talks about, and that's what the reference came from here. All right, then. So now, what do you require to understand the social psychology of human dynamics? And why do I have this here? Well, one of the things that we forget often and on, the essence and the criticality of what we do really boils down to the dynamics between persons, agencies, and programs, and how decisions are made. What are people thinking when decisions are made? What is their psychological makeup, and what is that allows them to do that? To do all these things that we have, which is defining boundaries, like building trust, building the potential for collaborative action. How we can do that. Trust, well, it's the core of people working together. We can talk about it all the time. We can always say, we should work together on that. That's a common phrase we share. But what does that really mean? You can't work with everybody. Does it mean that? Or does it mean you have to figure out ways to work with everybody? And how much are you willing to do that? What is your mental situation in terms of willingness to work with folks, even those that you do not necessarily agree with? What is your temperament, your level of temperament, and that kind of thing? And then develop a common sense of identity and values. How do you move towards that? So defining the boundaries, on that one. So can you work with people who you actually don't agree with, either politically or otherwise, because you all share a common idea, which is you want to be able to carry out a service that's a critical service. You just don't agree on how to get there, or you agree on how to get there, and then how do you work together to make that happen? And then how do you make the first step, which is looking at what do you actually share in common, as opposed to what your differences are. And most of the time, we all know this to be true over and over again. We have much more in common than we do in terms of differences. And the problem is what can we, making the decision at the end of the day, in terms of human dynamics, what is it that we're willing to work with? What is that in terms of building that relationships? What are the areas in which we're willing to compromise and work with? So that means engaging beneficiaries, those that define or who are we mutually benefiting, and then what are the solutions we're going to come up with. So what I suggest and what literature suggests and what we have learned years and years and years, us who have been doing this for decades, what we have learned is a couple of things. We have learned that it's important to deal up front with whatever your conflicts are. Do not just hold off, dealing with them. So that means utilizing diverse and creative ways to mediate what it is you're going to do. For example, one-to-one conversations, educational workshop, group discussion, and so forth. And to address root cause issues, and it's not easy, not even close to easy, particularly issues that are very, very volatile, about, holding people accountable or either holding them accountable for recent things that are done or long-term things that are done. For example, the work that a lot of people do in dealing with conflicts related to racism and sexism and those sort of things. Developing a mutual and a multi-stakeholder environment that allows for permission, for these things to occur. Remember, we said these are stubborn challenges. Systems change is not something that you could just sort of, I'm going to go to a course on how to change systems and then I'll know how to do this forever. No, that's not how it works. What it means is that you learn the principles and then you have to practice, and you have to make hard decisions. You have to get people to agree. So the social and collaborative environments that says we could do this, these shared understanding of what it would mean for us to continue to do what we need to do, that's really critical. So going back to something that Ms. Roberts asked about the political environment, that's constantly changing. This is what we say, because we may agree with some parts of that political environment, we may disagree with other parts of that political environment. But reality is that is the environment in which we live, where we have do that. And our decision needs to be in a collective way. Do we create a working environment that allows us to function, that says we will deal with what we agree with and we don't agree with as part of our reality, and not let that stop us from carrying out the good work that we do. We could do that. We could spend huge amounts of time and energy focusing on the ways in which conflicts occurs, and we do that. And that's human nature. That's what we do. But the social dynamics of the human dynamics of that says that is not a productive way to get things done. And so that's kind of what we need to say. Do we face the challenges? And also means creating an environment that allows us to have those discussions, the hard conversations, and it's not easy to do that. And it's not, we can't have it every time we have a conversation. No, that's not work. We have to get to agree to which things that there are times, you meet people and you'll meet them 5 or 6 times. And those 5 or 6 times, it's only one time you could actually have a real conversation related to things that you may or may not agree with. The other times, you're just going to have to proceed with getting the work done. So what does that mean? That means that as a leader, you have to build the capacity beyond the program to allow you to function. Because the question becomes that you now are in a position where you are the decision maker. You have those that are under you that you are that you are responsible for. And so that means that you yourself in this system, remember, systems change works in a dynamic environment. It does not work in a static environment. Things do just not remain the same, despite what we would like to do. Things are constantly changing, and we're constantly being challenged to address those changes. So that means that the increase of potential participation person is all levels who may be, or who be responsible for implementing whatever it is that an organization, whether it's our institution or not, system change. We need to be able to make sure that those people have the potential for involvement. Easy? No. Must it happen? Yes. Our role as leaders is to promote and create that opportunity as best we can. And how it's going to work? 80, 90% of the time, it'll work. 10% of the time, it won't. And it won't. That's totally intractable. We cannot move this brick wall no matter how hard we try. That's our reality. But as leaders, we need to model how do you deal with that? What is our role? How do we deal with that? How do we do this? And so we need to strengthen the organization and study buy-in by doing these things. increase what is the self-awareness that we have, making sure that we have at least healthy, trusting, and robust relationships that allow us to at least admit there are things that we cannot make change, as rare that may be not. And then how do we work with it? How do we work with that? How do you work with, for example, in situations that we run into, the COVID is a good example of like where 90% of you, or, maybe vaccinated, but there's that 10% that won't be vaccinated no matter what you do, what you say, even if it means firing them. Okay, that's their decision. But their decision affects the other folks that you're responsible for. So you as a leader now have this dynamic, and and you have to look at what is the root cause. Do you have built into your institution, an environment that allows you to have really good, healthy conversations with people who may or may not agree, even with the policies, within your institution itself? How do you deal with that? And do you have one where that could be healthily dealt with and then robustly dealt with? And then creation of opportunities to negotiate, how that work and figure out what needs to be done. It is not easy being responsible, particularly in an environment that's constantly changing, particularly environments where people's lives and welfare and livelihoods are on the line, like the ones that most of us deal with all the time. Whether or not they're direct reporters to us, or because our agency deals with people's at that level. So that means that we need to make sure that we are in position where we have levels, high levels, respected levels, understood levels of transparency and communication. And we use the word transparency all the time. And I know, something it becomes cliche, but what we really means is that people should not guess what it is that you as a leader are going to say or think. Now, there are going to be times that you have to make executive decisions, no question about it. But at least you need to say, I cannot give you an answer right now because I haven't totally figured out how to make that work. At least you're being honest about it. They may not be happy, but at least they understand that, you're that way, you're in a position on that. And your job then from that point is to find out as much as you can to make that decision, this. But and when you're planning programs, you need to make sure you build into those programs these types of things. So the other bit in terms of a program plan, in terms of intervention, is of course a communication tree, a communication line, of who's responsible for what, who has what roles, how that's going to work. And then a shared understanding and practice of diversity, equity, and inclusion, which is something that is long-term. And it's not, even though DEI is having it today, we've been dealing with this issue for a very long time. Us who've worked in this area for a long time. So what I want to do is talk about and end with this section with about 7 recommendations that who come from this. So these are lessons that all of us have learned in one capacity or another on this thing. The first is that if we're going to promote systems change, we need to foster a community and cultivate networks. In other words, work well with others and work well with other networks and programs and services and groups, and build those such that it's been that. And you all have in your region, Chatham and Savannah, you have some very good networks that work together well, and particularly in the time frame that we have. And that includes those that are in political arenas as well, because they're major decision makers because they have policies that affect your day-to-day operations. Work at multiple levels of scale. In other words, they're not just the direct service element of that. You continually, as leaders, have to be considering the dynamics among those that are in your system, in your institution, in the workplace that you have. How are they dealing with each other? How are they working together? And at the same time, how they feel about working together? Are they taken care of? As I mentioned earlier, one of the challenges I know we've had, which is us, in our university system, is making sure that people who are faculty and staff, besides just our students, their emotional, social, emotional, and mental health well-being has been adequately addressed to the point where they feel okay. So we know that they're doing their job and they're working together. We know all that. But what we don't know and we have to pay attention to is making sure that they are okay themselves and that they're taking care of themselves. and that's part of the work there as well, as an example. Another thing is that self-organization, making sure that that you are promoting people's ability to make good decisions, and at the same time make good decisions and allow them to also be creative and also come up with ways to make things done. That has been really, really clear in these last couple of years, where we're dealing with a very challenging physical, social health environment, where people have had to sort of spur of the moment, think of ways to make the stuff work. And we need to make sure that our space that we work in, and you as leaders have given people the permission and the ability to do that and work with them. Some of the ideas are great and some of the ideas are not great, but people need to have the space to be able to do that if they're going to work within these programs. And opportunities when they arise, right, which we have, funding, for example, of things that we wanted to see a long time to support mental health challenges. Well, right now, the opportunity that funding is out there to begin to address challenges, mental health in particular, for those groups that have not been able to receive these services. Now there's funding to do that. Now there's ways to train people. Now there's work to be done, for example. And then, of course, food services programs or housing programs, all of these things, as well as this health, mental health, go ahead. And then make sure that we give up and we make sure that we direct and that make sure the change happens. You are responsible as a leader to make sure that you are facilitating, and making sure that the idea behind change is occurring the way it is, and assume that the change is going to take place, in a timely manner, and be prepared for serendipity, which is always a good thing if you work in community work, because stuff comes up that you may not see coming. No matter how good you are and how well you've done, serendipity occurs. So surprises do occur. Now, one of the things that I want to leave you with is a quote for this section that I thought was really good in the research that we've done. Misrule and Maxwell, I mentioned them earlier. They state that the promise of a systems approach is finding solutions that match the scale of the complex problem. In other words, then, we know that that the things that we work on, particularly in our area, are very complex. And in the work that we do, is done, not in a vacuum, and it has multiple layers to it. So scaling up, multiple layers at levels of leadership, layers at program implementation, intervention, the actual clients themselves, all those things. We are challenged to work on program development and change and create systems, particularly systems that allow for this, that are in line with the problems we have. And we do this by what we have learned, and what we continue to learn and what we share amongst ourselves and different networks that we have. So I want to leave this section with that part before we go to the next one, and see if you have any comments or questions. Because I've covered a lot in this section. And
Dr. Telfair, I'm just thinking about, there are so many times that we work on programs within our community that might be under an idea of a program, and then it might be useful for us to think about how we move from a program to a systems change, because a systems change can include a program. Right. And
right.
So I don't want to muddy the waters a lot. I think it's worth us having some discussion about, or even a few comments from the group about how we think about that. Because, for instance, the work that Vera does is, very much a programmatic offer to the community around mindful self-compassion and suicide prevention and that work. And the where it comes to a systems change might be how people approach their work differently because of the program, or how they may approach the work they do with other people because of the program. And then that leads to a different way of working with people that then precipitates a change in how police officers respond to calls, or, you know, those kinds of pieces that create or disrupt the way we've always done things. So when I think of systems change in a very simple way, it's about disrupting the way we've always done things. And so I would love to hear from the group how they think about systems change, very briefly. Not everybody at one time.
I will say, like, thinking outside the box.
Okay.
I would say kind of about, it goes hand in hand with sustainability, something that we want to change for the future and continue to move towards, like, step by step.
Following on Ruby on that same thing of sustainability, and especially what you were saying about having a plan for when there's turnover or there's someone new coming in and out, the system changed with that. Because even if the system was a certain way, someone understood something differently than I did, and doing it a different way.
So let me pose something to Laura and Ruby then. So Laura, I know you run the Fresh Express program, and so let me ask you this. Do you think about systems change as for, because right now we're trying to expand it, the need is there, we know that, but do you think that you guys are also looking at it as if at someday we may not need to actually go bring healthy food to people to give it away? And of course, and I know that I'm in the position I'm sitting in, that's how I look at it as a systems change. Are you taking that into consideration relative to healthy foods?
So taking into consideration into eventually it will end and it'll be more available. I mean, that would be a great all over goal. Yeah. So I guess within the next years of once there's, more availability to healthy food, that'll be a great thing that we don't have to do anymore because it's available. But yes, within growth too, though, moving into having that available to other parts of Chatham County too is part of systems change too, instead of just keep doing the same old 2 stops. Yeah.
I would say too, that's why we try and include those public benefit flyers there as well, to kind of encourage people to then take advantage of those public benefits that then could come full circle back around to like Forsyth Farmers Market, and they can get those double there. So that allows them to take advantage of the public benefit, but also have the ability to then purchase their own fresh produce.
So the question that I would also ask the group, because this is kind of what y'all are getting at, is a level of comfort, for change, right? I mean, we all it came to where we sit because we were able to work with that sort of the status quo a bit, and then or even push a bit on the status quo, but it still allowed us to sit where we sit. However, we know that some of the things that we aspire to will require some change that some people would consider radical or whatever, may not be, whatever. But what is so the question would be, given where you sit and given the things that you discuss, system change also means that you have a level of comfort. Either your agency has a level of comfort, your network has a level of comfort, you have a perfect personal level of comfort for change that may make what you do different in order to achieve what you need to achieve. So that's my question to the group.
I would say that stepping into systems change work, you have to accept that level of discomfort, and also the idea that there's something that exists that's bigger outside of yourself and your organization, and that's ultimately the goal that you're working towards. You acknowledge that there's something greater than yourselves and that you can do and that you're striving for, and that's what motivates and empowers the work that you're doing.
And
I'll
I
add-
would
I'd like to
add,
add, go ahead.
We have 3 people, so why don't we go with, because Miss Ann Keller was first, because I saw her pop up first, and then Dr. Smalls, and then Miss Nichelle.
Hey, you can call me Connie Keller.
Okay, then.
Thank you so much for this. And I love this stuff. Lizanne, I really liked your question, and it really spoke to me because obviously so many of us are working in direct service to the community, and those needs are there, and they're always going to be. Hopefully they're not always going to be there, but right now, I mean, yeah, we're trying to feed people, or we're trying to clothe people, or we're trying to find homes for people, or educate them, or whatever, that direct service, right? And then, but we're hopefully always thinking about how do I transition, or how do I continue to serve those direct needs while also working on the thing that caused that need, right? Like, the upstream, downstream, I got to continue saving these babies, but sooner or later, I got to run up there and find out why they're all falling in the stream, right? So yeah, how do we do that? How do we juggle that? And I guess I'll give a little bit more of our time to continue that and then move over. So I didn't have anything to answer that, but I love your question, and I think that's the difficulty we're facing sometimes, right?
I want to say just one quick thing about that. And so this is where that leadership piece of us shows up. And sometimes it's going to feel like we're stepping out on a ledge and we don't know if there's ground underneath us. So I'm just I think we have to claim that part of it. It's like that. There's a great visual I have of that. An older movie, Harrison Ford's trying to get from across this great abyss and to save his father. And he is stepping, it's called the leap, I think it's called the leap of faith or something. And it looks like he's going to step out into this great abyss. And he steps out and there's a small ledge. And that's where we have to, like, sometimes it feels extraordinarily uncomfortable for us to do. So, and then I'll say one more quick story, and then we'll go to Dr. Smalls and Nichelle. I was talking with, many of you know Molly Lieberman. And so I was talking with Molly about this grant that we're working on that has to do with systems change and policy. And many of you may know she's been working on mindfulness zones, right? And so I said, okay, Molly, how do we, we've got to think about systems change with the mindfulness zone project, because that's an environment change. But then how do we work in a systems piece? Or then how is it replicable? Could we put it in a replicable area? So we're talking over here, meeting over here, and this is another part that I really do believe in, because great ideas float in the air. So we're talking over here, we have a couple of conversations, and Molly's getting a little bit more comfortable with this idea of being able to replicate. And then all of a sudden, bam, we get a call from a state agency saying, hey, can you meet with us about mindfulness zones? We want to learn more about how we can replicate it at a state level inside 0 to 5 daycare centers, like that. And so that's where we have to get in that uncomfortable place. So with that, I will turn my mic off and be quiet.
For now, yes.
Thank you so much, Liz. And it's sort of like a good segue into what I wanted to share in terms of my thoughts about system change. Everyone has definitely added some really good information. And one thing that I think about in terms of real system change or the movement, evolution of system changes. It relates to being comfortable versus uncomfortable, but it's a redistribution of power, because we realize that what's in systems that are historical systems are seats of power. And so when you talk about systems change, there has to be this willingness. And even I think Dr. Telfair mentioned it in earlier, and sometimes it's actually you have to fight for it. This redistribution of power that has to occur, and hoping that as these conversations go about, and this learning goes about, and this sharing of information goes about, and education among different groups of people, and that everyone has an opportunity to share in these conversations from whatever vantage point, whatever experience, perspectives they've had. We have to be open to do that. And then, of course, being willing to give up some of the power and redistribute the power. And that speaks, for me, it speaks to sustainability, because when more people are involved at all levels, from all walks, from all experience, from all the backgrounds, then you have this rich group of people together that are keeping this system moving in the direction that we hope that it will move in. But as long as there are pockets of power, it's a difficult place to be, and we have to be open to doing that. That's my 2 cents, and I'll turn it over to Nichelle.
I'll add a half penny. Thank you, Dr. Smalls. A lot of what has previously been said touched on what I was thinking. I'll just talk about system change versus programming. And the way I look at it is that you can affect systems change through the use of programs, but a program whose goal is finite, whose goal is to kind of, as Connie said, kind of catch the babies downstream, are very different from the ones that the programs that help you walk up the bridge or walk up the mountain to get at the upstream problem. The other thing that crossed my mind was that that organizations that hope to affect systems change are neither effective nor credible if they internally, both the individuals internally and the organizations themselves, are not moving along those lines themselves. I think, and I'm echoing a lot of what has already been said, but the image to me that comes up is it's tugboat. I think the organizations are these tugboats that are guiding these bigger, more massive systems, and we have to guide them, and we have to have the same kind of momentum, or they will continue along their own path, and we'll be stationary. That's my half penny. Thank you.
Thank you. Anybody else?
I was thinking when people were talking about sustainability, a word that kept coming to my mind is relevance, because you can have a system and it's very relevant and it serves the people now, but 2 years, 5 years, or even Dr. Smalls, when you realize that you really do have to redistribute the power, you become irrelevant. So you may have all the resources you need to stay sustainable, because in my mind, sustainability just means that you have the resources to keep doing what you want to do, but you become irrelevant. And then in that irrelevance, it's just, you don't work. You're just there, or the system is just there.
Okay, thank you. Others?
I want to just chime in here also.
Mhm.
This information is so good, and I'm sitting here muted and saying amen to every slide. I promise you that.
Thank
And
you.
Lizanne, I struggle to even comment because sometimes you feel as the leader of the program that you're implementing, you really want to say, can we have this class again? And those that we're accountable to be sitting and listening along with us so we can go back to our various places and have the discussions. Because like what Nichelle said, the tugboat kind of situation and the power distribution, Ms. Elsie said, I think it has to do with us being in the middle of those that we serve, the communities that we're passionate about, the programs that we deliver and we're passionate about. How do we mediate and satisfy them and satisfy and be accountable to those that give us the positions to serve? You know what I'm saying? So I'm like, I'm so glad this is being recorded. I want to know from Lizanne how we can, get the recording, because I would love to sit with those that I'm accountable to just, kind of regurgitate and express some of this information about the systems and the challenges of working with the systems. But I appreciate this so much.
Thank you, Angela, for just showing the gratitude that I think we all have for Dr. Telfair leading us in this learning and discussion. We will share the recording. It'll be available to everybody. So we'll be happy to do that. And then I think the other part is just to do a follow-up after we have our learning with other people that we may want to bring to the table to have a bigger, robust, maybe community-centric discussion around systems change, program design and evaluation, and the importance of all these components to really help us grow and learn and grow new leaders too. I'm getting longer in the tooth, and I want to make sure that this is part of the, the next group of leaders who are on this call this morning, that we transition very, very well, and that we have the skills and knowledge in order to do that. So, and I'm always, I've learned to, I've been at this a long time, and I'm learning new stuff this morning, right? I think that's the whole key to all of this, is that we continually learn and sharpen our saw. So it'll be available. Anybody else have any comments before we re-engage? All wonderful thoughts.
Okay.
I have two concepts that really stuck in my mind that I believe that they're very applicable for our community and all the changes that we're having. And it's the concept of diversity, equity, inclusion. Something that at times we tend to forget because we are so used to the way how we have been doing things in our community that maybe we forget to include all of us here. And at the same token, the last step of the systems of change, that is the evaluation of the effectiveness of what we are doing, and see, like the Dr. Telfair was saying, it's not written in stone, and be able to be very dynamic within the process.
Thanks.
This is just a quick question. I don't know that there's an answer to, but I'm considering as we go through this, is there room for the systems that are effective? How are we, do we take that into account? I know there are a lot of systems that do. Do we learn learn from those? How do we learn from those systems that do work and have potential to be useful in the future?
Yeah. So yeah, thank you for both and everyone for the comment. I will answer your question. I just don't know if there's anybody else that has something they want to say, but I had two things that I can cover. Okay, so the first thing, before I get to Mr. Michelle, before I get to your thing, the one thing that is a common thread that you all have, which is great for this. I'm not sure. I gotta, okay, comment, Ms. McCray, can you explain what you mean? Oh, sorry, okay. Anyway, the two things that I have in common,
She's just saying that she's got to leave because
Yeah.
there's a vehicle she works for Chatham EMS.
I got you. I saw that. I'm sorry, I read it again and understood what
Okay.
I should know acronyms by now, but yeah, okay. But the other thing is creating the level of comfort. Like this group and the network that you, Ms. Robert and Ms. Chrysler, y'all, and all you all who are on this one or networking, y'all have a pretty decent network, you know, that you've worked with and you've cultivated and you've grown over time. And one of the things that you have that's really critical to systems change is that you constantly are allowing yourself to be challenged. You create a network where we're being challenged from your perspective and your point of view and so forth is something that you all just have. It's, you know, not every group of folks have that, which is why it's a real hard to see change happen. But you all are a group where you could realistically come together, you know, in mass, not just individually, but in mass, and have substantive conversations for change, because this is your culture. This is the culture you've created. And when I was talking about the social, psychological, human dynamics, that's what I was talking about, is the culture that you've created. There are constant things that are constantly challenging that culture, like what Ms. Everson said about DEI, you know, but it's been around a long time. All of us here know that. However, it's having a moment. And that moment is really also then bringing to the forefront a lot of these other challenges. That's the first thing. The second thing is that the way we have learned, and you all know this, we have learned that the way that you learn from things that work and doesn't work is that you allow them to be, you know, you allow them to share what they have and to assess what they have, you know, in some way, shape, or form. But the best way to do it is to use mediums, you know, either written mediums, either, you know, bringing together other groups and organizations, and so forth, because we all know that there are programs that work, and they only work because of the people in that program, in those services. But in terms of the challenge, like what Ms. Robert was saying about carrying on, we have all seen it where very strong leader, very dynamic, very charismatic person can make a lot of stuff happen and happen for a good while. But when that person no longer is the hub, things can fall apart. So there's a two-part there. One of it is that, you know, it's the persons have, you know, whether or not these persons can put their finger a lot of times on the secret that makes them work is not always there. They just know it works. This is who I am, my personality. And sometimes they can do that, which is why we shift a lot to coming up with structures and models that you can adapt or learn from and work with. And talk about what the fit is. The very first question that Ms. Roberts asked was, how do you make these dynamics related to policy and other things fit into the models? That's an excellent question for you, Ms. Michelle, because what that means is that you look at programs that work and you get them to think about what it is about them that works and how can they create a way that can be replicated, you know, and even if it's the basics of it, that can be replicated and grown, because they should be able to articulate and explain that. And some programs can do that, others cannot. But I can tell you that the ones that cannot are the ones that generally are not the ones you still see around, because they have not been able to do that. And our experience has been that. Our experience has been that those that can at least talk about the basics of how it works and can share with you that are the ones around. And that's the ones you should focus on to learn from. Even though the others may be successful, it's the ones that can actually allow you to learn from them, replicate from them, and do that. And how they do that is through the different mediums, the sharing, the writing stuff down, the creating things. All these models that you see I talked about in the DAP process are all adaptations of things that's moved from promising to best practices, approaches to doing things, and that can be articulated and replicated. So when we talk about this, and we listen to one another, we have a very common way of talking about these things. And we could document that common way of talking about these things. And because we could do that, that means we could learn from one another. And we can write that down. So that's my answer to your question, is the deliberate effort, and Ms. Severson put her finger on it, is to assess it, your deliberate effort to put those things down. So my challenge on systems change is that all of you have great wisdom about how it works, and you also have lived experience about how it works. You know, and I agree, yes, you know, holding people accountable, but the way you hold them accountable is to challenge one another to be able to articulate those things in such a way that you can learn from one another. You know, you don't have a coalition, you don't have a network, you don't have any of these things if you are part of that group, but you work in a silo. Remember, silos are not how we get things done. I mean, that's what systems, a lot of systems are, but those are like really, you know, the kinds of ones you don't want to gravitate to. You want to gravitate those that sort of like, you know, and you all had science, and your science, you had like a membrane that sort of has a solid line around it. But what you want is you want one that has what's called a semi-permeable membrane, which means that instead of having one big solid circle, it has dashes in the circle so that so things can flow in, can flow out. You know, that's how networks build it. That's how systems work, and that's how you can do that. So there's a lot of stuff because these are dynamic, means they're dynamic not in the sense of just the fact that there's a lot of stuff going on, but dynamics in the sense that over time things change, right? And so that's where the adaptation is. So what I'm suggesting is challenging you all to think about it, you know, that if you want to see systems change, particularly the way you want to see it, the level of comfort question is there. Is how much are you willing to learn, you know, and let things, how much are you willing to allow stuff to move around? The big question that came up, and I think it's a really good question, I think it came up, Ms. Dorsey asked the question, and this is one that all of us get, is that many of us sit in middle management or middle leadership roles. However, there are people above us that make decision, and there are people below us that makes decision. And our real challenge all the time is, how do we sort of make sure that because we're trying to do and achieve good outcomes, that we are able to have those shared and work with both for those above us and those below us, because we know there are things that influence the upper decision making, like in our system at the university system of Georgia makes decisions and they lay them down to the rest of us. And then there are those that are program people that so on that part. The thing about it is that you have to continue to adapt goals, values, and objectives and things that work for you, and then allow for you to have as one of your constant things you do is continuously both educating, two words that I would say, educating and being able to be really good at negotiating, right? Those are the two things, the skills that you really need to do if you're a middle management person, right? Because negotiation is the real tool that you have. Right? There's a book you all may know called Getting to Yes. You know, and one of the things around that is it walks you through how to do what's called principled negotiation. And the principled negotiation is a concept that's different than what we normally think negotiation is. We think negotiation is where two or more parties sit together, they argue stuff out, and then they come to some level of agreement. But how they came to the agreement was because each one of them felt they had to give something up. Well, principled negotiation doesn't work that way. You still can come to levels of agreement, but when you've come to reach of agreement where you didn't feel you have to give something up, you felt where these are areas in which I can realistically compromise and still get what we need. And so our approach is always going to be finding common ground. you know, and finding a way to make that work. The education side of it is going to be that, you know, creating an environment where new things or things change constantly has to be a part of the way you communicate and the way you deal with things, because others have to become accustomed to the fact of that. Otherwise, they're not going to really see there's going to be dictate to you or tell you that. That's where the leader as servant kind of role plays the thing. So part of that is that. Anyway, that's just my comment on this one. And I learned a lot from the comments y'all are making on this part. But any more on systems change?
I would just add on, I think a very small part of what you just said, Dr. Telfair, is, and I think we've seen this a lot in our community, where we have a lot of people come to the table, and there's a part about letting go of what we think or what our organization needs or whatever it is we're holding on to be able to have something bigger show up. And I don't know any other way to say it than to say it that way. That there's something about kind of showing up with a blank slate and sometimes and to be able to create something together, or either the idea of loaves and fishes, where everybody has, you know, a loaf and a fish, and everybody puts it in together, and then we have a bigger way of feeding lots of people, and sharing what we have. And I think that's another big part of the work, and especially in systems change work. Yeah. That's an integral part of that, kind of like making stone soup.
Right. Well, it's the expectation that is how you're going to get there, though, right? The accountability part is that you holding each of you share, you have common things that you hold each other accountable for, right? And part of that is the fact that you all will eventually come to some level of agreement on how to get things done. And, you know, and that's a level of comfort that you have to have, which a lot of this network does have already, but it's not shared across the board. We know that this is unique. You know, it's not you. It's unique, and honestly, it shouldn't be. You know, community, networks should have as one of their values, their drivers, the way that they work is that they are always coming to levels of agreement on how stuff gets done, expectations, accountability. So I agree with you. The loaves and fishes is a way to kind of grow. That's how that grows, you know, that trust and stuff. So anyway, we'll leave it at that. But I don't know if anybody else had comments. Otherwise, we have a 15-minute break at this point. Okay, so I think there's a comment in the chat. Okay. All right, so Mr. Turner has to leave. All right, so we have 15 minutes, so we'll come back at 12:15, and then we'll start back up again. So good discussion though. Appreciate it. All right, 12:15.
Thank you.
Ms. Roberts, I'm ready to start back whenever you are.
I think we're ready to go. Let's roll.
Okay.
Yep.
All right. Okay, so welcome back, everyone. So what we're going to do now for a little bit is we have a major section to go through. So this is going to be a bit of a lot of information. However, what we're going to cover has to do with the things that I mentioned earlier, which are the models. And so we'll talk about those. And what I would suggest is that you decide which of these models in terms of development and planning that you think work best for you. These are pretty standard models in the whole understanding and thinking of how you design programs, think about programs, and then where that works. And so we're going to kind of walk you through these, and some of these will be familiar to you, others may not. So let me go ahead and proceed. So I'm going to start with the classic public health education model that we use in a lot of program development work that we do in our neck of the woods, which is the Precede Proceed model. So first of all, what do we mean by Precede Proceed? So what that stands for, Precede stands for predisposing, reinforcing, enabling factors. The idea behind this actually has been around for a good long time. It goes back to what we said earlier, which is that when we're thinking about what it is that we do, we really need to figure out a way to structure what we say, how we present it, and how others receive it in a way that can be replicated and used. So way back, one of the stalwarts in our neck of the woods is Dr. Green, and what his colleague Dr. Krutler developed this whole approach to looking at the way that you consider what are the critical issues related to putting a program together. And remember, we talked about earlier that we need to consider what it is we want to accomplish, who our targets are, what do we want to see, and so forth. So this is part of that model. So in the early stages of focus on educating persons about health issues and challenges, they developed this model itself. So the first 4 phases, of this model, it's broken up into these things: precede and proceed. So the first part has to do with assessment, the phases, looking at the building the evidence, which is the social epidemiology, behavioral work, the assessment part of it, what's there, what's not. What do we want to focus on in terms of what do we want to teach and train people, and what is the overall learning environment, or action environment, or physical and social environment, as well as consider how are we going to carry this out given the realities we exist in, which are the administrative and policy environments that we have, and in our intervention and alignment. So these are the 4 phases. And so if you're considering how you're going to put a program together in a policy-driven environment, and/or an environment where you have to make arguments to those who are decision makers to support your program both in the short and the long run, the first part of this is a consideration. The second part is actually has more to do with, and this was added a bit later on, which is how to also make sure that you deal with this in the current reality, your political, regulatory, and organizational reality in which things occur. And then how do you make that work? I made the argument before that if you were in positions of leadership and power, negotiation and education are 2 things that are just very critical. And this is what the Proceed approach really talks about. It was developed a little bit later, but it also focuses mostly on how things are carried out. So what does it look like physically? Because you remember what I said earlier, that if you can draw it, you can realize it and understand it. So if you look at the models, now one of the cool things about this model is that it actually starts from the end and works itself backwards. So what it says is that consider what is it that you ultimately want to accomplish? What do you want the program and the services to accomplish? And then work backwards towards how you would get there. So you start with the first phase, which is the end of it, which is the quality of life, the social assessment part. You work on what kind of information or data or evidence you're going to need to make that happen. What is the environment in which things are going to occur? And then what are the structures you need to have in place to make those things occur? So if you look at how this works here in terms of the first 4 phases, it considers that. The other part then is that, okay, so once you've done all that, you've set it up, you've put the pre-work together and you've decided on that, now how are you going to make it work? So that means that you're going to have to look at, again, the administrative and the structural. So you cannot carry something out unless you have the means to make it happen. And the means to make it happen not only means the physical means, in other words, the personnel, the funding, so forth, but the decision-making means. Anyway, people who are going to back it, people are going to support it, people are going to make sure it's in place. Because we all are familiar with good ideas that started off, that had initial support, but just did not pan out in any real terms. So part of the early work is to make sure that we have the part, and one of y'all mentioned in the discussion, and I apologize, for missing it. I think it was someone responded to Dr. Smalls that said sustainment is a critical piece. And that is so true here, is because you want to get people supporting this in such a way that you want to be able to sustain the program itself. You want it to last. You don't want it to be something that comes and goes, which is what, unfortunately, a lot of this we have. And that has to do with dependent on funding. And that's why a lot of programs you read now, particularly programs you apply for, have that question. A lot of government agencies who fund you will ask the question, so how are you gonna make the program sustain or work if the funding runs out? And so thinking about how you want to do that is a critical piece of this project here. So implementation of how it's going to be carried out, assessing the actual work itself, and then making sure that you look at the 2 things. And if we were using a logic model, we would say that in the intermittent part of this is the assessment of the intermittent outcomes, and then you have the ultimate outcome, which is that part of it. So with Green and Krutner, this is the model, precede, proceed. Now more to it, to explain a little bit more, I'll give you the on this one. So essentially, this is how it's developed. This is what it is that you plug in your work, how you think it's going to work. So all of these things here are just what goes where. Now you have to decide on these things. So let me give you the definitions and what we're looking at. So analyses then, which is your first phase, is to define, things like quality of life. Basically, what it is that you think is a priority for your population. So going back to this, what is it that you really want to this program and these group of services to accomplish with? That's what you're looking at here. So it's best accomplished by involving what is it that's your priority in your self-assessment. For example, social indicators of quality of life and achievement. In other words, then good mental health, good physical health, healthy people eating and so forth. Things like alienation, comfort, dealing with crime, and so forth. Now, that's the first thing. So the second phase, as we said before, is when you have your needs assessment. And I would just say needs and asset assessment as well, which is looking at this work. So this is where you, as a planner, is deciding on what the data is going to need to inform how do you move forward. So in other words, then you are asking data to identify and rank or prioritize the things that you're trying to do. So it may be problems that you do that contribute to or interact with those that are in this phase, so they'll be covered. So in other words, that includes traditional things that you have. So what is it that you traditionally have in place, for example, for a generic program, behavioral program, and so forth? What are those kind of factors that are going to be there? What are the root factors you want to have? So, for example, ranking a health problem is critical. The other part of that is how you're going to structure it. So risk factors, determine the risk factors. In other words, then what are the push and pull issues, on that? What pushes you towards achieving what you want to have? What are the pull issues? And then so critical here is having a really good identified way, to gather the data, identify the data, label it, and then analyze it, and then use it. That is all very critical. It is early on in the process. Now, what's important then is the prioritization once you have that information. So one of the things to do in terms of practice is to get into the habit of developing priorities. That's really not an easy thing to do, given what we do for a living, is to prioritize things. But prioritization, and I'll say this more than once, prioritization does not mean elimination. Prioritization means that we have to decide what are the critical things we need to deal with right, initially, and then what do we do? So what do we have as our proximal challenges? What do we have as our intermittent challenges? And what do we have distally? Everything is there. It's just that we have to prioritize what do we deal with first, what do we deal with next, and then what do we eventually do? All of those things can be part of your change model and the model that you have here. So that means that creating a matrix helps a lot, because then you could plug in those things. So what's more changeable and what's more important, that's one quadrant. What's more changeable, what's less important is another quadrant. You'll see that it's a little further down. What's then, and then what's less changeable but very important is that these are your vexing, types of things you're going to deal with. And of course, what's less changeable and less important is, whether the program exists or not. So again, prioritization does not mean elimination. It just means putting into order the things that you really need to do in the planning process. So that leads us then to the third phase of pre-seed proceed, which is deciding on how you're going to label the types of work that you have. Now, there's 3 areas of work. So one of them is the things that are at a seed. In other words, that are the things that are in place. What are your assets? What are the things you already have? What's working and what's not? So if you are designing a program that provides mental health services for homeless persons, do you already have something in place that you could either build on, modify, or extend? Or do you have to start from scratch with this group? Particularly homeless persons that live in rural areas, which are really hard to get to, as opposed to living in more urban or metro areas. And that's your program, and that's what you're trying to do. And so you have to really think about that. And you have to think about the things that will get people to participate in the program itself. As you know, participation in a mental health or wellness program, just because it's labeled that does not mean people automatically say that that's what they want. So unlike the old saying, if you build it, they will come. Well, not necessarily. It depends on what they label it for. One of these days I'll tell you all a really great story about how we did something like this, and we learned the hard way that if we build it, it will come. And we did all the right stuff, we thought, and then they did not come. So, but that's a long story, and we'll do that for another time. But anyway, the idea here is to antecede the factors that impact motivation that allows for something to occur. So knowledge, attitudes, beliefs, perception, and values. Now, again, we live in an environment where we have levels of agreement and levels of disagreement. And there are all of these factors, here, as well as many others. So predisposing factors also means looking at and understanding areas in which there's commonality and in areas where there might be difference or challenge, and then making some decisions about a program in terms of how we're going to make those adjustments. And some of these are new, others are longstanding. But if you do a root cause analysis or root cause look, what are the origins or the genetic elements of this, as Green and Kruger calls them, you want to look at this. So then enabling factors, which are also antecedent, all the things that are there. If you have a program and there are services, for example, services to this population, then what is allowing that service to occur? What is the things that are supporting it? What are the things that you found challenges of that program, and then the ones that actually make the program work? So does the program exist, the antecedent? And then barriers in vehicles are things that were barriers or what's challenging the program from being more successful than what it is. And in vehicles, what is allowing it to occur? So skills, access, availability, rules and laws, all these things can either be a push or a pull on how the program works and that. And then reinforcing factors, which are the things that come once you put the program together. What do you see as will allow the program to continue or to be sustained in any real way? And that has to do with feedbacks and rewards. But example of these include things like social benefits as a recognition, appreciation, incentives, and disincentives, for not participating. again, if you build it, you want them to come. And so that means doing the work, you know, to understanding, okay, so just because people ask for something and you respond to their ask, does that mean that they also are going to appreciate that and then give you what it is? And that one of the hard lessons that we learned from years and years of work on this is that just because, you know, we are responding to what we're hearing people asking for does not necessarily mean that when we put it together and finally provide it, that they're going to participate at the level we want. And so we need to be thinking about how do we make sure that we are moving that. And that's again, need to be considered over as a temporal thing, as in the proximal response, the intermediate response, and then the long term. And so consider that. So that's what the reinforcing factors ask you to do. So when you prioritize healthcare and social service interventions, consider these 3 factors that influence your ability to get it, to see the change that you want, to see the program the way it is, to assure that the services are being carried out as they should. Now, then once you've done all that, now you have to look at what it is that needs to be done to align what the planning part of it is with the action part, with the processing part. And this alignment has to do with how things are overseen, how decisions are made, and what policies or what decisions that are written on that one. So you have to make sure that the intervention alignment matches the strategies and things you want to get done, as well as are there policies or decisions or laws and rules in place that allow for it to happen. So planners, you really do to think about, you all in leadership planning, you think about, you know, determine if the capabilities and the resources available and to develop this. So it's not just thinking about the funding. It's not just thinking about the personnel. It's not even thinking necessarily about the constituents who are going to benefit from what you have. You do have to take into account, again, we talked about systems, but it's the overarching systems of the higher up decision makers, rules, policies, and laws that need to be part of your strategic thinking as you put these things together. So just because you're asked to put a program together does not mean that you're responding to that program that it's going to happen. And constituents are not always the final decision makers. There are others. And so being able to negotiate well, think about negotiation, be strategic, you know, thinking about the challenge and ways to go about this. And that means thinking about the other 3 factors that I mentioned before, particularly the predisposing and enabling factors in particular, what's going to allow what you want to see happen. And so it is between phases 4 and 5 that the precede ends and the proceed begins. So before you even begin to do implementation, you really do need to do the work to make sure that these other phases, you know, are at a level at which you feel comfortable to proceed, and that you and those you are working with, particularly those in your network, feel comfortable to proceed. So there's really not a break in between, because this is not like a, you know, proceed and you move. No, these are interacting in dynamic things that interact and cross over one another. So constantly on your mind is as a strategic process. Remember, this is a dynamic and not a static process. So that means that things are going back and forth all the time, or decisions are being made. You know, the environments, the policies are being changed. The personnel that comes in and out of who works with you in terms of both the decision makers and frontline people, even the constituents themselves, depending on that. Particularly, for example, if you're doing a mental health for homeless program, you know that that's going to be a changing environment, particularly if that homeless population is a group of very diverse groups of persons, you know, who you know, or you know, comes from all different areas of the country. Maybe we mentioned the DEI situation. You know, we need to be thinking about multicultural, you know, multi-ethnic groups of persons, you know, even multi geographic groups of persons, you know, those persons that maybe in some way, shape, or form are not persons that have or are accustomed to being in one place for any period of time. So even though you may design a really good program for them, but their ability to take advantage of that is what something you should to consider. So they run together as planners and they move back and forth. That's my point here, is that these go. So let's move to the proceed part. Now, this begins when you think you have in hand appropriate resources and you're now thinking about interventions or strategies that will allow you to successfully implement what you've designed to do. Now, this crosses over into the assessment piece, which we are going to talk about in the timeframe that's going to come up in the next. We're going to cover this in great detail in our next training in the spring. But I just want to give you an idea of how this all fits together. So in this phase, which is your phase 6, 7, and 8, which are your last couple phases, measurement implementation to control, assure, or improve quality is there. So this whole idea of constant quality assessment, quality improvement, quality assessment, and then quality assurance are all concepts that you all have heard and understand. But however, they work together on that because they deal with the changes you're trying to make. So you have the definitions of these. So what we mean by that is you want to look at the impact or the observable effects of the program. And that's done through the intervention once it's done. You could do that by monitoring it, but what you're really committed to is what do you put in place to make the change happen? Because remember, interventions require some change target, and interventions are linked to evaluation. We'll talk about that another time, but monitoring is just looking at and saying, yeah, the program's working the way we think it should. But is if you want to measure change, in other words, going to make a difference, then you have to implement an evaluation program. And that's going to look at both impact and outcomes, which are the long-term effects of the program itself, to sustain things. So these are based on early phase of the model when you're thinking strategically, how you're going to make this work. So that means that all those things that I mentioned before in terms of the stakeholders, and the stakeholders do include everybody from workers, decision makers, and the policy makers and laws makers and so forth. You know, what is their dynamic or the interaction that will allow this to happen? And then but the other thing to consider, and this is something that, you know, the authors really came up with, you should consider these, but in the work itself, not all these phases are necessary, you know, on this. Many times though, they're going to be dependent on what is the requirement of the program you're trying to implement. You know, so one enabling factors may be a much more of a critical piece than, say, you know, the predisposing factors, you know, because you may not have that. So for example, if you are asked and an immediate opportunity presents itself that you've not in place and it's brand new, then your question doesn't necessarily, it does take into account, is it feasible? But what it really want to know is enabling. Do you have things in place that can make this work? And you may have to kind of start in the middle of the work itself or the middle of the decision itself, as opposed to from the luxury of starting from the beginning. Because let's face it, in many of the work that we do, we don't have the luxury of going through some really well-refined process. Sometimes we have to start in the middle of something. Like you may have, for example, this mental health homeless program that may be there. However, then something occurs where you see like what we've seen, which is a growing number of families that are homeless. You know, and that you didn't plan. That wasn't the plan when the program got started. The program got started because it was focusing mostly on male homeless persons. Now you have large numbers of families that need to have that sort of thing. And so that means the program's already up, running, and that sort of thing. So do you have in place? And so if the opportunity presents itself that you can support that, then that's where you start. So the different phases have a lot to do with what are you trying to do, which is why, as a reminder, you start off with what it is you want to accomplish first. So your quality of life question at the end of it. And so monitoring evaluation, and we're going to talk about that, but you also need to also look at what you're going to assess in the long run. Okay, so that's the precede proceed model. I don't know if there's any comments or questions before I move to the next one. Okay. All right then. So let's go to SWOT, which is strengths, weaknesses, opportunities, and threats, which you all are probably much more familiar with, given that this is a very common model that's used in terms of decision making and planning. So historically, it's a, you know, it's one of the ones that we are strategically been more associated with. And the reason why it is because the way that we work, the community folks, you know, there's a lot of dynamic stuff goes on. Ms. Roberts gave a great example of, you know, being stuck at one point and then, you know, an opportunity that they didn't even see coming serendipitously presented itself that allowed them to move on and to really structure what it is they were trying to get at and find support for. But it was serendipitous and it wasn't, they, you know, didn't see it coming. And so that happens a lot. So one of the ways to deal with that is a SWOT, because it gives you both rapid and allows you to look at what's out there. So there's two things to this. One of it is that you can make quick decisions through the planning process. However, it also means you have to apply what it is you know. So in other words, if you're like many of us, the way we work is that we are constantly looking for opportunities that will allow us to support what it is that we are passionate for, what our program is about, and that sort of thing. And keep in our head, you know, what has worked, what hasn't worked, ideas, and so forth. That's good. And so that's why people who do this approach really like it, because it allows them to do both really robust, structural type of planning and work, but at the same time, use their gut, you know, in terms of things that they think work, use their lived experience to influence what it has. And so, you know, but the challenge of it is, and that's why I have it here in the second bullet, is that, yeah, that's good, but it also can be something that is a real challenging, can lead to really poor planned programs and on that one. So I would say use with caution. And it happens a lot of times when you all will get approached by someone that says, we would like to see this program, you know, you're reacting to, say, an immediate issue that has popped up, you know, and that you want to design a program that really addresses that. And someone says, well, we'll support you to do that, but we'll only give you a month to come up with a way to get it done. And so that means it's rushed and that kind of deal. So yes, it's good in the sense that it allows you to put something together like that, but at the same time, you really need to proceed with caution. And you need to think about how you're going to get it done. So it structurally, it looks like this in a model. And again, like I said, if you can draw it, then you can make it happen. So, and we're going to continue to look at ways. So this is the template that you have. People use this a lot in strategic planning. So the pre-discussion and the work that's done, but it's a strategic plan and allows you to look at how you might want to do this. So if you're thinking about a program you want to have, then you consider this. So every one of these, you know, they have two components to them. You know, one of it is, and I'll go to the next slide to give you a sense of it. So two components to each of these squares. One of them is what the program does. You consider what the program does well, what resources you have in place, personnel, clinical expertise, and so forth. Those are all your strengths. Those are the things that you bring to the table to address this particular challenge. The weaknesses are just the opposite, if you will, which is what is not done well and where there's a lot of room. And that goes not only in terms of what you as a program did not do well, but also what may be some of the barriers or challenges you have to face, like regulations or policies or lack of resources or leadership, upper leadership, middle leadership, you know, lower leadership challenges, personnel challenges, and so forth. So you have to really think about that. These are like influencing factors, you know, that has a lot to do with you consider what things work. And so where do you want to go? That's what the opportunity question is. Okay, so we know where we have strengths and weaknesses and things we can do and what are our challenges, but where do we want to go with this? You know, what do we want to look at? And what do we think we can do given what we know about ourselves? So unfulfilled clients' needs, which is actually why you're thinking about this particular program or service, and then luciding or removing of these practice barriers, looking at available resources that might present themselves, you know, or even new practices that people are coming about. So yeah, like right now, when you're looking at developing programs that have an emphasis on poverty, for example, or emphasis on working with rural communities, an emphasis on dealing with crime, you know, emphasis on being able to provide better services for feeding individuals and families and so forth. There's a lot of now in our current time, a lot of resources that are being focused on these things from the federal level, with the Buy Back Better plans, for example, that's supporting a lot of this work in rural areas. I have a colleague who works in a rural clinic who has struggled for many years. And we've been interacting with them. And one of the things that they said to us very recently is that they asked us to help them because they now are in an area where, because of the federal availability of resources, they just have to ask for the funding. But even that is not a skill that they had. So they were asking us to help them write the proposal, for the funding, even and to just get it, because the funding is available. All they got to do is ask for it. So that didn't exist in just like a year ago or even more. So these opportunities, for example, that present themselves for collaboration and other things allow that too. And then it's so important to not forget this. Root cause, and root cause is linked to history. So what are the trends? We cannot, we should not, and we cannot, and we should not forget history when you're trying to do program planning. It's one thing to be of the moment. It's another thing to also not forget how that moment came to be. And so I'll say that again. It's one thing to be of the moment and respond to that and put programs together and so forth for that. But don't forget how you got from there to here, because that is why that happens so many times, is not paying attention to that. That's a poor strategy to forget history. There are groups of people that you're working with or plan to work with, but those people just didn't sort of come out of the ether. And the challenges and issues that they have didn't just come up overnight. These are long-standing challenges that most of us deal with, and they're complex, and they're stubborn. And so we need to make sure that we do our due diligence and our homework and our work to try to understand the best we can of how things got from there to here. So threats, are those things that occur, and have we ask ourselves, when we think at the history, is that have we adequately dealt with those, or do we plan to have things in place that will allow us to deal with them as best we can and allow us to move forward? So again, don't forget history. Ask ourselves, have we dealt with it, or do we have things in place that will allow us to move forward based on that history, that understanding? And that is a tough thing to think about, because it not only means you as a decision maker, leader decision maker, but it includes you have to be engaged. You have to engage. Engaged is different than being just regular participation. It means people have to commit, to the change that you really want, that is there and the way you want to go with this. So the SWOT analysis does allow you to do that. Any comments on this one?
Dr. Telfair, I learned first about SWOT in business environment, and the recommendation then was to look at strengths and weaknesses as internal facing and opportunities and threats as outward facing. I don't necessarily want to muddy the waters here, but any comment relative to that?
Yeah, and that's, I think that is when in the business environment, it's because I'm a public health person, I look at the ecological approach to SWOT, because you could, in the environment that you learned it, that is very relevant. They're looking at literally their own business. So they're very siloed, very myopic, that sort of thing. But what I'm suggesting is that we're talking about community leadership, right? And so community leadership means that you look outside, you look at both your environment, but the environments that you interact with and you network with. So what I'm suggesting is that, yes, you look at the SWOT components, but they have also to do with what you do as well as what you who are partners with. So you at Celtics Savannah, your network, you have a big network, and so if you did a SWOT analysis, it wouldn't do you much good to just solely look at one of your programs. You have to look at the bigger picture of that. Does that make sense?
Yeah, absolutely. No, I was just thinking maybe some other folks here on the call maybe had seen it from that approach too and needed exactly what you provided. Thank you.
Well, I'm open. If anybody else want to ask that, I thank you for that, because that's a really good question. Thank you for that.
So Dr. Telfair, would you, I'm looking at this. Yeah, just like Paula, I learned about SWOT through business application marketing and things like that. So thank you, Paula, because that really brought me to think about, would you recommend using that type of SWOT analysis, not just for your own program itself, but also, I mean, kind of, as you said, in an ecological sense, use it for the issues. I mean, you could almost do that SWOT analysis with a lot of different aspects of the issue that you're addressing, right? I mean, I know that makes it a bit complicated, but what are the two main ways that you would see using this in a systems change environment?
Okay, so yeah, so you added another question there, another dynamic when you throw in systems change. Okay, so let me back up to your first part. The answer is yes, like you and Ms. Kressler is talking about internally, of course, that it's a good model to use, no question about it. But it's limited, you know, in the sense that it's very sort of siloed to that particular unit. The second thing I would say is that the second way to answer your question is that when you are thinking about the working with your partners or your network, you know, it's a really good way to provide, you know, insights for yourself, because you're learning, as well as those you're trying to educate about your network. For example, you're applying to CDC for a grant, or HRSA, or a philanthropic organization who may not know that, you know, about your network, the network you have, that you do, that your program they may know about, but you also know you work with others. And so one of the things to be able to do is to be able to show, you know, do, you know, your assessment before you put together the application itself. Because if you do a SWOT analysis, that, as you know, provides you with some really good information about who you are, what you do, and that, as well as those you work with. So if you pull groups together, say for example, you have 5 agencies and collectively you all want to go after you know, a broad grant, say on mental health services or food services, or I'm not sure what, Ms. Keller, what agency you work with, but you know, you and 5 others, you know, that may be similar or different, you know, bringing you all together pre-writing or pre-planning, and you do a SWOT analysis collectively, I am more than confident strengthen your application. So that's the second thing. The systems change bit that's where the really rubber hits the road, because you're talking about, you know, institutions, you know, either in thought or in practice that oversee your agency and similar ones like you. And so, you know, that's where the rub there is, that you have to come together and be willing to be honest and open about the elements of the SWOT analyses. Because it's not enough to just say, here's our strengths, weaknesses, and so forth. You got to say, honestly, these are our strengths. Honestly, these are our weaknesses. And you got to be open to debate on that not all systems are ready to go there, right? They'll stop after the S. Okay, and then leave it in, if you know what I mean, you know, because that's all they're comfortable talking about. Everything else becomes, you know, falls into that morass of, you know, feelings and politics and all the other kinds of things. So that's the third answer to what you're saying, but consider that in mind. And you've done that, but that's part of strategic planning, right? So if you write into the way you're going to go this is strategic planning, do that. And it also falls into what I said about history. You know, you have to understand how things work, how programs work, how things traditionally have come together, right? So if you work in a system that is, you know, has been traditionally resistant to doing that kind of open, honest discussion and work, that means that you have to plan accordingly, right? You have to be thinking about pre-think, how do we go about getting these people there? Your colleague that asked about talking to upper administration, or is upper administration usually open to honest assessment of what they do, or are they, run into, whether they're, things get a little ruffled, and also, is that a system that they will put rules in place, but allow you to have some flexibility to have those rules to do that, so you get the point, if that makes sense.
Yes, thank you so much.
Thank you. Others? Okay, all right. So we'll talk more, then we'll go to the next model, which is a little bit more rapid assessment that has more to do, you all who've learned this in business it's a little bit different. So this is a quality improvement model. So what it assumes is that you have a program, either in place or a program that you want to get started and work on. And so you want to focus on the things that will allow you to do a better job and be informed. It's an evidence building, evidence supportive type of process. So there's three kind of measures, looking at outcome measures, which is at the end of the day, what do we have? Process measures, which is the things that you measure along the way in terms of implementation of the program, and then balancing measures. And balancing measures means, that, okay, so here's what is going on. What kind of adjustments do we need to make in order to make the program go where we said? So here's the structure, the template, as I promise you, I always provide you with a template. So here's a template. And so the template says the measurement for research or assessment. And so across the top, you have these two areas, which is measurement for research or assessment, and then measures for learning and process improvement. So quality improvement focuses on this, but it also focuses on these other 5 areas, which is purpose, testing, bias, and data. The area that I want you to really focus on the most is the last column for the most part, because this is where change is allowed to happen. If you focus solely on just assessment without input for that assessment, you're going to be pretty stagnated, and you're going to actually miss the forest for the trees kind of thing. And it's not going to allow you to make the change. So I would just say, focus on these things where improvement really happens, which is bringing new knowledge, making observational tests along the way. In other words, making adjustments along the way, having flexibility. If you remember early on, we said it in program, you have to have that kind of flexibility and adaptability, biases from the test to test. In other words, things that might influence it, and then gathering just enough data to learn and complete another cycle, and then small tests. So how does it work? So you start off with the question in terms of the PDSA cycle, and you want to say, what are you trying to accomplish? How will you know that a change is an improvement? And then what change can you make that will result in that improvement? And so remember, you have these components here: purpose, test, bias, data, and then duration, which is, seeing test occurs. All right, so the question that you're having, which is Nolan and Shaw asked, is, are general ideas with proven merit and sound scientific or logical foundations, can they stimulate ideas? In other words, then, if you have root cause analyses, which is what I strongly suggest that you pay attention to. History, root cause. Why do things exist the way they are? What is it that? It's not just saying, if you ask someone a question, why do you have poverty? And the answer is, well, because people aren't fed enough, or they don't get paid enough, or whatever. So those are like, surface answers. We all know that the causes of poverty it goes much deeper. The roots of poverty are much deeper than that. And they have a lot to do with not only just the fact that certain resources don't exist, but there are systems in place that allow for these resources not to exist or to exist. And so when you started saying, okay, let's examine the systems, that means now you're getting to the root cause. You're getting to like the origins of why why this does not occur. And that requires work. And so the work is by a multidisciplinary team that does a critical analysis. And a critical analysis means not just a surface answer, but a really diving deep into the issue itself and coming up with that. And you all who've been working in this for a long time, you have that. It also means that the analysis is directed towards finding out what really happened. Why is it the way it is, and establishing factors that are going to address this. So essentially what we're saying is that a PDSA allows you to start off with asking the bigger question, and then moving towards getting at what do you need to have at the end of the effort that allows you to say, we are going to put in place change. We're going to put in place efforts that allow us to literally, change the dynamics of why something exists. In other words, why is there poverty in our community? It's not enough to just say we need to bring resources to the table. We do that all the time, but the poverty still exists, and it still exists and it grows. So why? That means we have to deal with it at the multi-levels. Remember, one of the things we said earlier about planning is that problems are complex, and that all stages or multiple stages of solutions need to be, considered, and then how those solutions and multi-stage needs to work. So it's not just, all it doesn't mean that one is necessarily better than the other in terms of efficacy, because whatever change you make at whatever level you make that change, that's a good thing. But the reality is that you cannot, sit on that. That's necessary, but it's not sufficient to accomplish what you need. It's necessary to have change at multiple levels at which a challenge occurs, but it's not sufficient. What you need to do is move on to where now you're dealing with them, and that you actually are seeing the change at all these levels, and you're sustaining the change at all these levels, and you're putting things in place that are going to assure that stage does not go away. Now that's the long-term work. That's kind of working ourselves out of a job, but that's kind of what we're talking about on this one. And PDSA makes you seriously consider that. So how does it work? So here's the drawing again. So the three things that we said you need to consider when you put together a PDSA cycle, which is, what do you want to try to accomplish? How will you know that the change you had is moved? And then what can you change? So the part of it you start with is deciding on what the change is, just like with the precede, proceed, and in the change or the test things you want to do. Then you determine what changes you need to do, which is your act part. And then you need to assess, summarize what you learned, summarize the changes you made, whatever, and then you intervene and you carry out what that part of it. And so the result or the improvement you want to see. So plan, do, study, act. Now there's another name for this, which I'm sorry, I'm blanking on it, that people in business do, but in our neck of the woods in health, it's a PDSA, plan, do, study, act. But I know in business there's another term for I think the study part, which is assess or work on that. All right. So the type of change that you want to look at, and when we're talking about this, and this is the accomplish at all levels of complexity, is we're going to look at things like eliminating waste, improving workflow, optimizing inventory or how things work. Thank you, Ms. Saunders. Okay, I was reminded that it's plan, do, check, and act. Yes, okay. But I heard also assess, but thank you. The other part of it is the work environment you want to look at. You want to look at how you manage time, manage variations, and so forth. These are all ways that the literature is talking about these in terms of how you do this approach. So here's another example of the quality improvement process. So now I want to point out a couple of things before we do this. So what you see here are multiple cycles, if you will, of this. So the plan, do, study, act approach is not a one-off. What it's designed to do is designed to assess change, as it builds upon one another. So the improvement process is just that, it's a process. And each one of, and it's designed to build off one another in stages. So for example, this is the thing, and forgive my drawing of this, I had to redraw it. So my apologies. It's I am not an artiste. I just, I know what stuff should look like, and I do my best. Anyway, so the idea is that it's a conceptual flow of how things work. And so this is just an example of this coming from the business part. And this, I pulled this from the department, the North South Wales Department of Health, which is a really good website, and it really kind of carries you through this. And that's why I gave you the full reference here. But what they were saying is that what they have is a project mission. And so they've decided that they want to do improvements as it relates to the work that they're doing related to customer service. And so they listed where they're going to collect the data from. These are all data sources that they have. And so they're going to look at these data. So they decide customer service needs to be improved in terms of where we carry things out. Here's our data sources, and let's use that. And so they're going to carry out multiple assessments over a 2-month period to do the Plan, Do, Study, Act. And that's their intervention phase here. So they'll start off with based upon what they've learned, and then they will take this and learn, what did we learn from that? And then they will start off and based on what they learned, and they will design an informed plan to go to the next cycle. And then what they learn from this, form a plan and so forth. So you could do multiple cycles is what we're saying here. How many of these you do is really up to you, because quality improvement is a decision that you and your team need to make. So you as a leader will have to work with others to decide on, what is working and what's not. And then how many of these do we need to get where we want to go? The good thing, advantage of PDSA is that it allows you to do rapid assessments. And rapid assessment does, means both, yes, you could do this in a shorter period of time, but it doesn't reduce the robustness or the quality. You're basically doing mini studies, mini assessments, that are evidence-based, that allows you to make sound decisions. But it's done in a very systematic way, and allows you to assess improvement and make judgments about improvement that way. So what they're showing you here is that they've done multiple cycles over 2 months, and then they implemented what they to test out based on what they learned from this last cycle, which has been built on by these cycles, and then determine what goes there. And then, the last one is sustaining the improvement, how they're going to do that. And then they start over again. And so this is why I like this table. It's a little chunky looking, and that's my fault, but you could see kind of what you're looking at. So you go from these different, initial stages to developing your data, and then doing your PDSAs, and then following that. And that allows you to assess improvement over time. Now, here's another way to look at this. And this is done because we do what we call mixed methods or mixed approach ways to do this. And this is called an embedded design. It is embedded design. And so what you have then is you have an embedded intervention. And so just like with the PDSA, you learn from these. So you have an impact phase and learn that. So you could do the same thing with these cycles, one or more of these PDSA cycles that will provide you with the evidence that you need. Then you decide what will the intervention look like. So if customer service, in terms of health delivery, which is in New South Wales, they are looking at how they're going to deliver better diagnostic services, to their customers, in such a way. And they do this PSA cycle. So now what they want to do is they want to do an uptake and design an intervention based solely on this outcome that they're trying to achieve, which is how providers of services. And then within that, all of this is done together, which is, and they decide on the interventions themselves. And then they do another testing of it, and they use PDSA to show improvement on this. And this is something from the Easy Clinical Guide, and it's there. And again, I would highly recommend that you pull that PDF up. It's free, it's online, and they really walk you through it in a much more articulate and better explaining it than I do. However, I think you get the point here. And I have one other thing to show you. So how do you use this to make decisions, right? That's the key thing that we want to know. How do you use that to make decisions? So this drawing gets you there. So you ask yourself, what changes do we need to be made? And so at each stage of the cycle, you do these things. You adapt the change, you test it out, you implement it. You adapt the change, you test it out, you implement it. You figure out what it is, you act, right? And so use this for small scale changes. And this is done this. Now the key word here It's incremental. We have to consider that a lot of the stuff that we do we're not going to make these big grand changes to stuff, right? We have a program in place. And we did get funded for the program, say, for 5 years. However, we meet monthly to discuss the program in terms of the quality, the process, and work that's being done. And part of that discussion is to come to an agreement or not, whether stuff is working the way we think it should. And then if we think we need to reconsider, which I think intermittently you should do, then we need to figure out how we're going to make that work. The really cool thing about a PDSA is it allows you then to quickly, rapidly put in place a means to which to that. So if you meet quarterly, monthly or quarterly, you could do a PDSA assessment monthly or quarterly and come up with evidence that allows you then to make sound, informed decisions. The other thing about this is that if you are in a position where you constantly have to report to those who are above you, mostly quarterly and by biannually and so forth, these types of small assessment in terms of the actual process and in terms of the actual quality of a program allows you to do this rapid assessment in such a way that it gives you quality work and informed work and it can carry things out. So that's what it is. As you do these little small tests, study the effects and act on what you learn. That is such a critical thing. And that's the cool thing about this is that as a planning model and in a predictive model, it is one of the ones that allows you to address things independent of what that. At other times you have stuff that influences this, like policy decisions, changing rules, changing laws, changing the physical environment in which you work in and so forth. And here's just another way of looking at how it works. So you come from what it is you think, multiple cycles, and then the change that improves that. And this is just another way to look at that. And I thought it'd be really good to show you multiple ways. Here's another thing that we also might want to consider. Say you have here a single idea and a single things that you're testing out, say a service, particular service under a particular program. But you are in a position where you now have to consider looking at multiple programs, like bringing up, you have an umbrella program and you have multiple services under that program. So you could simultaneously carry out multiple PDSA cycles and testing on different services and program, and then come up with the results to make a decision about it. Because say this happens all the time. You are in positions where you have to decide, you only have so much resources for so many services. You can't continue to support, if you have 10 services, you can't continue to support all 10. You got to make decisions about, do you keep, toss, combine. Keep, toss, combine. And one of the ways you can understand that is by doing stuff that allows you to develop these and ask these questions using multiple PDSA cycles on all 10. And then at the end of that, you can have your program, your service people do this, because you can train them to do this. You can then make a decision at the end of the day, if you had to pick 5 of the 10, which of the 5 do you need to work with? And again, do you keep, toss, keep as is, toss, or get rid of, and or combine? And this type of work in terms of planning and program development will allow you to do that as a model, particularly in quality improvement. Now, the other aspect of this is the last thing that's on that list, which is impact, not quite the last things, but it's close to the last thing, which is impact on sustainment and measurement. So this, you can measure, put in place measurement of change or interventions. You can record those results, revise the intervention, and then monitor how things go. So if you have to make a change because of services that are under a particular program, this is a way to really look at that and make that part of that. And where you can assess these mostly through a change assessment process, which is an evaluation process. So each one of these cycles does have that under them, and you can do that. Another thing to think about, a way to look at this, is answering the sustainment question. And most of the stuff you're going to do is involved with that. So once you have an intervention that's been introduced, the question of is it worth sustaining? And so this may involve these things here: standardization, documentation, and training, right? And these are standardization of existing systems. In other words, they may exist. If your homeless program was already in place, and you are now looking at expanding it so that it now includes both men and families, you know, and or it moves to homeless persons that have, you know, are challenged by mental health issues, which a lot of people, you know, may be part of that work. And then what do? And then you document now the new policies and protocols that you have to put in place for your program itself. And then you look at how are they working out and how the programs are being influenced work out, and then what's going to be your standard of practice or your best practice. And then, you know, that will give you then what you need to put together the protocols and the policy manuals and instruction manuals to do the training, you know, of your persons. And all of these are part of a sustainment process, right? And it allows you to sustain what you have, because you may, as I said earlier, when you are looking at programs like this, when they fall apart is generally when things like, you know, you have a very strong leader and or two in a program, or you have a program that in and of itself changes, and you do not have something in place that's nimble enough to allow for you to adapt to that change, then you're going to have these. So sustainment needs to be part of these things and in that work. Okay, so that's the PDSA work. And so the PDSA work allows you then to look at quality improvement and look at quality improvement from a perspective that is not only from decision-making role, an assessment role, to then moving to sustainment. Any comments or questions before I move to the next phase? Because we're going to switch gears a little bit. All right, then. So we're going to move to the next one. Let's see. I just had to pause. I got to pause for a moment. I got to check my schedule here. Okay. All right, so we're going to look next, we're going to switch gears and focus on intervention mapping. And I'm going to actually go over this a little bit faster than I had planned, because a lot of this I'm going to repeat next time we meet with the evaluation, because a lot of this has to do with that. But I thought it would be important for our discussion on this, because this is an approach that incorporates a lot of the other models into one model. And because it has a lot to do with how you structure a plan and how you consider a plan, how you structure it, how you implement it, and how you assess it. And it gives you more of a way to do this. Now, this was developed a while back by Bartholomew and colleagues. And she actually teaches a workshop for planners and leaders and planners, you know, for the most part on this one. Now, intervention mapping, if you have not heard it before, allows you then to do this building like the PDSA, but only a little bit more structured and a little more involved. And it's designed not only to just assess if a program is working or not, but it's also designed to allow you to have flexibility in terms of problem solving and change that occurs. So, you know, it allows you to do that part. It's designed then to fill a gap sort of in our neck of the woods, was health promotion and practice. And it incorporates pre-seed, proceed, as well as some other models. And planners for it allows you to really structure and put in these design and matrix. And it's really straightforward. So it's a 6-part process. So the steps in it, and I'll go over these briefly here and then a little bit more elaboration in a moment. It starts with, like I said, incorporate. So
Dr. Telfair,
yes.
Just to let you know, the preview slide screen is showing up on my screen here. It's not the full screen of the slide.
Okay, all right. Let me try this again. Sorry.
That's okay.
Get out and get back in. Is it still preview side? Okay. Is it the full slide now?
Yes, it's the full slide now. Thank you.
Okay, all right. All right, so this one incorporates the others and it kind of shows you how to do this. So I would just say that if you're thinking about an approach that is an overarching approach to how you would do planning. The intervention mapping is a way to consider this on that one. So it incorporates the needs assessment. It incorporates your thinking about what kind of change you want to have. It provides you with a model or structure or way you think about it in terms of practical application. It kind of focuses on what it is you eventually want to do, what the adaptation or implementation you have, and then how to assess it. So again, the drawing of it is this. So based on Bartholomew and their work, particularly the recent work in 2016, these are the steps that you have. They're pretty straightforward, and they incorporate a lot of stuff that we discussed already. So the first step, which is putting together the model of the challenge that you have, which is you all make a decision about what is it that you want to look at, your problem statement, if you will. And then, the context, the things we talked about, everything we talked about, the population, the setting, the policies, the community, and then you set your goals in terms of what you want to do. Then you make the next decision, like we did with precede proceed part, as well as the other models, is that then you decide on what your objectives are, and what is the things you want to see, what is the change you want to accomplish. And then you design the program the way you want to structure it. So overarching program, services, work, and so forth. And then you produce what it is that you have. In other words, then this is what it is you're trying to do. So if it's a service program and your service is designed for mental health services for persons who are homeless, then what you're producing then is work that addresses these at all levels, at multiple levels. And you are documenting that work, you are doing the training for the persons on that work, you're getting feedback for that work, and so forth. And then if you're developing ways to carry this out, which is what we talked about in terms of replicability, which I mentioned earlier, is a way to do this. It helps you to explain how the program works. So messages, materials, and protocols, as well as this, allows you to explain to how the program works and how you can also better understand that. And you explain it to the constituents and stakeholders of the program itself. Really critical piece here on this one. Implementing the program itself in terms of all the persons that are engaged and involved with that implementation. And then the outcomes you want to see, and as we talked about, the performance part you want to go to. And then of course, the evaluation steps, which we're going to cover at another time. So how does it work in terms of this? And let me just spell it out a little bit more in more detail, is that you do a pre-assessment. And I just gave you some examples of things you can look at. Assess health problems, behavioral, environmental conditions, the risk population intervention, and look at assets for all of these things as not only just needs assessment, but assets as well, which is focusing on your ability to implement this work. Now, this assessment itself has two components to it. It has evidence building, which is scientific, epidemiologic, behavioral, and social, of the at-risk groups of the community in which you're trying to assess. The other component is one that you all really should have a good sense of, which is that not only does you build evidence, but you also use what you know. So you use what you know, and you build on what you know to understand the community and the work that's there. And remember, we talked about the SWOT analyses. This allows you then to incorporate that approach as well. So not only is it precede proceed, the PDSA, but it also includes the SWOT, but from a community perspective, a broader community perspective, as we discussed. Okay. And the other assessment part, of course, is to continue to do that work. But the piece that I really want to point out to you is that it allows you to do the decision-making bit where you assess and you figure out what's going on there. And then you look at the outcomes of what it is you want to accomplish and on the work. Just like with precede, you look at the end of the day, what that is. Now, the other part is the main question, is specify who will make the change. So in your group or in your organization as a leader, are you going to be responsible for this, or are you going to delegate this work and effort to others to make that work happen, right? And so the thing that you want to be able to do is think about this through. So the crucial pieces, and I really wanted to make this clear, and I strongly suggest this, as you are doing planning or making decisions about planning, really consider, the knowledge, skills, of those of others who would be best positioned to make this happen, right? So you are working in a group together, and you're a leader, and you have to make a call. you may, for one particular program or one particular service, there might be a particular one person in your team who has the requisite knowledge and skills. That may not be a good fit for these other services that you're trying to do. But here's where you as a decision maker or a planner need to decide. The other thing is that, say you're applying for more funding or work, and you're working with a network of groups. In other words, multiple agencies. Who should be the lead agency? You know, it shouldn't always be you. You know, it's what you need to make this out is who would be the best group to represent you all for this particular opportunity that presents itself. So in other words, then round table, not square table. Round table, not square table. Because, you know, everyone, if you're working as a network and you work together, everyone will have a chance to be in a leadership role or opportunity. But what you really want to do is you want to present the best person and or group and or organization that they're the ones that should be on this one. And this is, remember, we said this, if you all participated in our grant writing bit, we made that point there as well, is that who is the best to lead this? So think about these crucial bits here and to think about that. So clarity of this, who is better able to do this, and listen to one another, which is what I'm saying here, because there are changes to be made, but how you go about making those changes and setting those objectives up, you don't know. So here is the task that needs to be done. Would you make clarity on the change? You know, make sure that you sort of label the change that you want correctly. It's either as a behavioral change, social change, economic change, you know, spiritual change, and so forth, or some combination of that. And then select what is changeable and who is important and who could best have that. So again, who are the best person you could delegate to that? Is it yourself or is it others? And then create a matrix of change that you want to accomplish. And this could be at all the levels at which you plan to intervene, you know, and looking at that and develop a set of change objectives and crossing those with your performance objectives. So change objectives is what difference you want to see made. Performance objectives, as you know, are those that assess or assure what it is you want to do and want to carry out. So that means you're measuring change, which are more outcome oriented, and you're measuring performance, which is more process oriented. Change, outcome oriented, performance, process oriented. And they are interrelated. And so development of matrix then is you create these, you know, where you're creating this matrix to show that, and then you look at the outcomes of these matrices based upon what it is you're trying to do. And then both going and looking at both outcomes related or long-term, and then either intermittent changes for the intervention. So you're measuring that as you go. Again, what the PDSA cycle allows you to do, as well as the pre-seed proceed allows you to do. So then strategies in terms of developing a conceptual or theoretical model. Anyway, structurally, what does it look like? What are you doing? What is your intervention method or approach? You know, and there's a bunch of those that are out there. And if you're applying, for example, you're applying for a Robert Wood Johnson grant, for example, and it has a community change model, well, that's a conceptual model. That has all these components and these elements to it that tells you what changes in the community should have. If it's a DEI model, diversity, equity, inclusion approach, then it shows you that. It's a multicultural model, shows you that. It's a change model that's a clinical model that says, you know, you're going to see change in the physiology of the persons you're working with. Is an economic model that talks about changes in terms of the types of economic type of changes you made and so forth. Those should be a critical piece of that. Whether you're a theorist or not, it doesn't matter. You should at least have a model, and I've shown you multiple ones you could use, and think about those as well. So those would be what influences that. So you could have models that are there in the application you have, or models that are used as your change models. And I've given you multiple ones for adaptation for DAP models, which is the development and planning models. The critical point is that here, which I want to point out, is that it needs to be one that is strategically linked to your goals and your objectives. Whether your overarching goals, your change objectives, as well as your performance objectives, this stuff needs to be linked strategically. In other words, then you're asking yourself, how does it all fit together? And that's one part of strategy. The other part of strategy, as you know, is being anticipatory. You know, if people are reviewing the work that you're doing, whether or not it's a work that you're doing in terms of an application for support, whether or not they're policy people or just upper decision makers reviewing this, whether they're even the constituents or the people that you are trying to reach as your target population, they're also reviewing what it is that you're talking about. All of these persons needs to have a really good understanding of that, you know, of what it is that you're talking about. And the way that you make that happen is that you be anticipatory. You have a strategy that says, we're going to make sure that whatever it is we're doing or trying to do, or what have we done or whatever, who we're targeting, we're considering that. So in other words, then the more straightforward thing to do is simply think, who are our stakeholders? And then how are we communicating to our stakeholders this work? And how do we make sure that if we are successful in doing this work, you know, what will we see? And that is your intervention approach, is that designing an intervention in such a way that the influence of the change you're trying to make is understood, it's usable, you know, and it's measurable. So again, and I'll read it because I have it here, which is the strategy is a way organize and operationalize, which is making it measurable, defining it and measuring it, your intervention methods. So that's kind of what she's saying here. The other piece, what they're saying, which is you have this in front of you, but you know, choosing the approach or the model you're going to have is to think about strategy, about the information and the evidence that you want to build. Now, how you think about that is the practical strategies for delivering the methods to whoever it is you're targeting, your intervention group, which is the term she used, but we also could use your consumers, you know, the clients, you know, whomever it is that you're trying to get at, their other stakeholders, and then ensure that the final strategies, you know, and she uses the word still, and that's why I with here, match the change objectives. Because what can happen is something that she points out and her team points out, is that you can get really far in the weeds, you know, with this work, because it's really straightforward, easy to do, just because you're really trying to make sure that you're reaching who you need to reach. And you can get lost in the weeds, you know, and you can forget what it is that your overarching goal is, what it is your change objectives are, or your performance objectives are, and how they fit together. And you can kind of get lost in terms of how do you want to present that. And at the end of it, you find, even if you're supported or have the funding for it, that you kind of like are not able to realize, or you sort of like things that just sort of are just now routine and tasks, as opposed to considerably being critical about how things done. And let me just make a point here. This outcome that she's talking about, and we'll get to strategy, is that strategy is going to be linked to the implementation of the program itself. So one thing that I would say as a warning to do, because happens to us all the time, is that we get caught up in the service delivery elements of these, and our day-to-day kind of focus is the service delivery. And we forget that we also need to be asking ourselves honest questions about, you know, are we reaching the people we want to reach? Are we making a change in those persons we want to make, or those situations we want to make? Or are we communicating that clearly in those things? The stuff that actually drives and makes that happen, it's very easily for us to lose sight of, because we're very, very focused on making sure that needs are met. And that's the honest way we should be looking at ourselves. So in other words, then do our own self-assessments in our program, or program self-assessments. And that should be a continuous process, just like with the PDSA allow you to do that as a performance assessment, you know, or a quality assessment. Those are worth it. And they're worth it in the sense that you learn from them, you make sure things are getting done from them. And also they are on a human level, they allow you to be able to continue to have the sense of purpose and intent and juice you need to keep going. Because it's very easy to get burnt out doing what you do if you do not sort of continue to remind yourself why you're here and what you're doing. So keep that in mind. All right, so moving to the next thing is program development, which is our topic here today. And so these are just things she said, and we've discussed these already, so I won't go over these much in detail, because she thinks of critical steps which we label slightly different, which is needs or demands. What do we need to get it work? And then communicating what we have. Remember, we said communication is so critical and important. Now, the other thing around program development tasks is that, you know, from her perspective, in terms of leadership, is that you consult, in other words, you interact with the people that you are working with at all levels. You bring their ideas together, you create and review them in terms of looking at them qualitatively. You do an assessment of the scope, programs, and the themes or key words that they're bringing to you. You make a list of those things in terms of this, that, and this is kind of all the components of what's called a rapid qualitative assessment that allows you then to robustly look at things. You need the programs, and then you compare the documents and design. And again, you review these and you pre-test these, just like the PDSA cycle. Now, the other component to this, you know, is allows you then to adapt and create the implementation, which is the program sustainability part. And, you know, those are there in terms of the work and the objectives you have. So I won't go into those in great detail beyond just kind of pointing out to you the work that she said, which is specifically the performance objectives. What do you want to see change, adopt, change, and sustain, and then designing the intervention itself. Okay. Now, the crucial part of program evaluation, we will discuss it another time, is that you have this intervention mapping, you're going to assess the program. So this is the last piece that she has. And we're going to go over this in more detail when we talk about it again, but I just wanted to point out to you this last thing around program evaluation task, which is to look at and see what is the logic approach you want to use. And I'll go over that. I gave you a handout, which is give you alternatives to logic models that I would like, you know, take a look at and see. The program assessment model matrix was one of the things I handed out to you to consider for that. Because I know y'all are accustomed to logic models, but the challenge of logic models is that they're not dynamic. They're usually pretty static, but you want to develop something that is sustained, and you want to develop something that looks at outcomes. So all of these outcomes that she's talking about are dynamic outcomes: quality of life changes, health changes, behavioral changes, environmental changes, which is both social and physical environment. Program objectives move around, and evaluation questions were there to look at and consider. And so we'll talk about this again, but the outcome of addressing your program evaluation is that it allows you in this type of approach to address issues that come up and to arise. All right, and then the last thing I want to cover today, let's see if you have any questions about the questions. No. Intervention mapping questions. All right then. So the last thing I want to cover for today in section, what I go over is just this whole thing of overview and pre-planning. And then we'll move next week into the other bit of this. So what I've presented to you so far is a lot of the efforts that need to go into thinking about all of this and into how it should work, what the strategic efforts should be, and the program you would do. If I had to put this in a time frame, is what I've covered on the other bits. I would say that this is like if you have the time, because I know in reality a lot of times stuff comes at you very rapidly. You have to make very quick decisions. In terms of putting these together, you have maybe less than a week, maybe a couple of days or whatever. However, it's critically important that you step aside every once in a while and program work that you do and spend some time, a couple weeks, just looking at the other stuff I've talked about, the modeling that needs to be done, the critical thinking, the problem solving, all those things. I would suggest spending a couple of weeks, on these things for each either program you have or services you have, to retake a look at this. It's worth your time, and you'll see that at the end of the day, you will have major improvements, major decision making, and you'll become much better at delivering what it is you need to deliver. So that's what I would leave with that other bit, and so that's why I wanted to move into talking about this planning process. So the planning process itself is the next big step, from the development work, because now you're thinking about what are you going to put in place? So the questions you need to ask yourself is, what is the mandate? Who is the client? Who is the client? Is the client the actual person receiving the services, or are they the other constituents and so forth, or all the above? What is your geographic unit of interest? You know, and I added this in here because it's important in our neck of the woods here in the coastal area, and in the lower rural part of the state, is that we a lot of times are not considering the unique characteristics that these geographic areas provide us with. And we need to do that because we have a lot of overlap. But at the same time, we have to think about what do we do and how do we target our services. We here in our unit here at Georgia Southern, you know, at Southern, we pay a lot of attention to rural, and there's a huge part of this neck of the woods that rural is critical, you know, and that means that there's some really unique characteristics and dynamics we have to pay attention to. Who is the target population? How comprehensive can we be? We know while we pay attention to this, it's a complex area, but we can only do so much. And then what is your time frame? What do you need to work with? So those are all your planning things to think about. So here is a matrix that we pulled from and we've adapted. So this is adapted from Bond, Boyd, and Rapp, and this is taking stock. And taking stock is a strategic planning manual that was designed for people in business, and so we adapted it for community work. And so that's why it looks a little different. So if you went to Bond, you know, the book here, Taking Stock, you'll see this looks slightly different. And so we've adapted it, and we've adapted a while back. But what we're saying is that overall program planning and measurement process is something you need to understand. So let me be clear on this. So we have divided, you know, in our leadership, you know, our foundation of leadership approach and certificate program is dividing this up into two big components. When we were meeting on this, we sort of initially, we're going to have all these things as one big thing. Some of you may recall this. We had a plan, and then COVID hit, and we had to break things up. Well, that actually, as you know, sometimes, you know, situations like that turn into even, you know, disasters sometimes provide opportunity. And so what the opportunity provided us with was to rethink how we're going to talk to you all about this. And so what we came up with is that it made more sense to try to overwhelm you with program planning, strategic planning, all hosting all at once, but to break it up and to provide you with enough time and a way to look at this so that you get it. You get a chance to like get it, think about it in more detail. So this is framed here is essentially that. Or say the looking at this from a planning and measurement part is you want to look at now the assessment part. So you frame the evaluation, you know, based upon the steps of planning. And so those 4 bullets in the first column literally are everything I've covered up to this point. Then we're going to move into talking about goals and objectives, you know, in terms of how to develop those and put those together, how to build evidence, and then how to make sense of that evidence. Those are going to be the next kind of phase of this, but I wanted to give you at least a preview so that you can understand this. So let's talk about the early planning process. So this is before you get to there. So what are the needs you're trying to address? And then what are the needs are best identified? In other words, remember we talked about prioritizing, and that's your opportunity. Who are you targeting? And I'll say this probably 20 times, be really clear about who it is, who your audience is, because we forget that, right? We may design a program or service, and we forget sometimes who it is that we're really targeting. We have generic terms like mothers or babies or families, but what do we mean when we say that? And who are we intended? And as was pointed out earlier, you know, do we also pay attention to change? Do we pay attention to who's actually benefiting from this in terms of that audience and who's not benefiting from it, and the whys, the root causes of the whys? So, and then what factors influence participation and program involvement? And then strategies. Think about that. Think about the strategies. Think about the resources we have And then the level of resources that we have, what can we possibly do? And then how can we strategically grow that? It was used earlier of loaves and fishes as an approach, which we all are very accustomed to. But also we need to be thinking about this. What do we have in place, in terms of, funds, personnel, paid and volunteer, and then what in-kind contributions? How can we make use of those? And so we need to think about why we have the program in the first place. So philosophy, purpose, the thing that we talk about sort of not so directly is that we can have 3 or 4 different programs that are all designed to do the same thing, provide services to person who have HIV and AIDS, for example. We may have like 3 or 4 of these programs that exist. Now, on the surface, by name, they all sound like they're doing the same thing. But in reality, we know that that's not the case, because while there may be common services that are provided, the philosophies and the reason why they exist and who they're targeting and how they're targeting and how the services are provided, all those things would vary. And there's a reason for that. It's why it exists in the first place. And there's a reason why some are sustained and some go because of that. So I think it's important as a planning consideration is the philosophy and the purpose that drives development and planning and decision making. That we forget that. We don't really pay attention to it because we work together so well many times. We think we're all basically on the same page, but reality is that we may have on the same page in terms of common purpose and intent and outcome, but why we do what we do, what drives us, what makes us push the programs we do, that's going to vary, which is why we have 3 or 4 different programs that on the surface look like the same thing. But if you really start digging, which is what I always encourage us to do, and do some critical thinking, you find out that philosophies, and reason why they exist, will vary. So philosophy is critical. So ownership of the planning process, by whomever, by the clinical staff, service staff, and so forth. Nurture the linkages between the information, how decisions are made. It's a lot of times, we mentioned earlier that some programs exist because you have a very strong personality that is over the program. And decisions are made. How does that person exercise their leadership? Are they more direct leadership? Are they micromanagers? Are they leaders as servants? All of those things will influence how program planning takes place. So, on that one, do they listen up and down the levels of perceived importance? And I do that perceived importance, but involve the involved. So those who have traditionally been subjects as part of the planning decision process, are they involved with this? Do the people in leadership roles allow that to happen? And if they do, how? What do they do? How do they structure that? Because we talk a lot about, community involvement and engagement. We do that a lot, but how do we make that work? How does that play itself out in real time or in reality? Yeah, that's the question. That's the question. What is your thing we talked about earlier about level of comfort? And I think someone mentioned the power dynamic question. Are we willing to people who, whatever the word traditionally, they are not in positions of power and authority. Do we give them that, allow them to have that? Do we share that with them? And what's our level of comfort? So think about that. And that has a lot to do with the philosophy and purpose of planning and how decisions are made. So you get the picture here that, existing programs, exist, and how they're perceived, what are the risks and the barriers of that? So one of the things to really get at that is the baseline assessment of the needs, services, and the constituencies, the institutions you work with, and so forth. A basis for services and a priority way to set priorities and who is involved in that effort itself. So a basic for targeting services, establishing a basis for needs and assessment, surveillance on that one, as well as establishing comparison of services and the way services work. I think that's what I had planned for today. I'm sorry, I got to double check this. Forgive me for a moment.
Dr. Telfair, it looked like through slide 83.
Yeah, got it.
Yeah.
Yeah. So I went a little bit over, but that's okay. I got it. Okay, so I'm going to stop there. On this one, I went a little bit over into the next section, but because it just gives you something to think about before we go. But I think we have just a couple minutes left in our time, whomever is still left, which is, wow, a large number of you. You know, so any questions or comments you have before we close out? Anything to think about? Okay.
Just from my perspective, I think then I'm speaking for myself in this as well. Is to take at least one or two pieces of what we learned today, and even if it's plan, do, study, act, and take something that we're working on and apply a model to it to ground the learning maybe before even next week, to go through an attempt with that. And if there's anybody that wants to partner to do that, I will offer up my me to learn alongside someone if they want to do that, because I think that's a way of grounding the learning before we bite off the next elephant toe. Which
so I will start back up. Thank you, Ms. Roberts. That's an excellent idea. I'll start back up in the philosophy next time, because to go over that, because I think that's important as a starting point. But yeah, you have in front of you tools that I've given you to do just that. You know, you have templates and materials that I've handed you. I would strongly suggest that everyone consider taking Ms. Roberts up on her recommendation, because the idea is just not for me to sort of present to you, but to try to have some degree of interaction, which is why if you look at our agenda, you know, I'm putting in the agenda, please talk, please ask questions, please engage, because that's the way I learn from you and vice versa. Anyway. Okay, that's all that I have. I'll turn it back over to you, Ms. Roberts, if you have any closing comments or whatever.
I just want to open it up for, we've got a lot of positive comments in the chat. I want to thank Healthy Savannah for walking alongside us on this journey, and just continuing for us to have meaningful, strong conversations, holding each other accountable, and really getting us to pay attention to what will help us, reach people that we want to make sure that we're reaching in our community, having an equity lens in the work that we do. And I just want to thank Dr. Telfair. We've had a lot, people have texted me while on my phone while I'm here, just saying how much they appreciate this. And we can't thank you enough, and look forward to next week. So for those of you, if you do have any comments, please speak now or ever hold your peas and carrots. And we'll see you next week directly after the CGIC health team meeting. We're going to keep that to an hour and go directly into this. And so perhaps next time we can call upon Nichelle Hoskins to get us up and stretch a little bit, maybe. All right. So we'll do that next time, because it's hard, I know, for all of us to sit for this length of time. So peace to all of you guys. Thanks so much, Dr. Telfair.
Great. Thank you. Thank you all for your nice comments. And please, next time, consider how can we interact. So Thank you. All right. Enjoy the rest of your day and the rest of your week. Thank you.